So we already went over housekeeping, just keeping yourself muted so everyone can hear me clearly. And I'll try to keep an eye out for the chat on the side if you guys want to put questions there. If we get through each section quickly, then we can kind of use the end portion of the section for Q&A if we have time. That's my goal. I'm going to try to share my screen now so that you guys can see my avatar. Okay. This one. Okay. I hope you guys can see it. While I'm sharing my screen, I don't really have access to view the chat. So that's going to be kind of difficult. I don't think I do, at least. Let me see. Oh, there it goes. Okay, I can see it. I'm figuring it out. Okay, so this is what your home view will look like in my avatar. Each of these little boxes are called widgets. The widget that you'll use to search for forms and to enter information into forms is the forms and data widget over here. You can organize forms right here by clicking edit and adding forms to it, and then put them in different sections and make it look all pretty and everything. This is the My Clients widget. You can search for clients right here just by typing in last name, comma, first name. So the first section we're going to be going over is the initial contact log bundle. This will be used when you make contact with a client and you need to get them into the system. It's your first step in registering a client. So as you can see, I've already added it here, but I'm just going to search for it down here so you guys can see what it looks like. You don't have to type the whole thing. You can just type a portion of it, and it'll give you a drop-down selection of different searches or results from that search. So a bundle is basically a bundle that consists of multiple forms. So when we search for a bundle and we go into a bundle, it's going to take us through different forms to complete a process in a workflow. You can also search for those forms individually, not in a bundle. So as you can see, it says initial contact log right here. That is a form inside of the initial contact log bundle. But we're going to go ahead and go into the initial contact log bundle so we can get all the forms at once. So let's say a client calls in and we need to enter them into the system. I double-clicked there. Here pops up the select client. This is where we can search for the client and see if they're new, see if they're an existing client. Let's see. So the client who's calling in, his last name is Phone, and his first name is I. And I said him, so let's just select male here. In this section here, you have to enter in 3 different pieces of information to search the client. So if you have not entered in 3 pieces of information, the search button here will be grayed out and you cannot click on it. Once you enter in 3 pieces, it becomes clickable. So let's click. Oh man, I think I've already created this one. But that's okay. What we can do is say there's 2 different people out there whose name is iPhone. You can still click on new client here, and it takes you into the first form of the initial contact log bundle. Okay, as you can see, it's plugged in the name that I searched here. Let's say they're calling in, so let's put incoming call here. Caller name, it's the client, so let's go ahead and type that in there. The more information you enter in, the better. So as a rule of thumb, enter in all the information that you have. The red fields are required fields, but if you have information for the fields that are not required, enter it in anyways, because it can show up on other reports if you run demographic reports or anything like that. So it's helpful to enter in all the information that you have. The contact type is self because it's the client calling in for themselves. They called in today and they called in right now. Let's say you forgot to enter someone in for yesterday. There's a little cheat here where you can go T as in today -1, and it will type in yesterday's date. You can do that for T -30, T minus whatever. Just a quick little thing there for you guys to make note of if you want to. So the program is MH Clinic Call because they're calling into, well, I work at the Phoenix Clinic, so they're calling into the Phoenix Clinic, so I'm going to select that. After I've selected all my information and entered it all in, I'm going to click on Submit over here in the left-hand margin. That's going to submit the form and take me to the next form within the bundle. Okay, so here we have information plugged in from the previous form, date of call, call time, the name, all that good stuff. Inbound call. So I'm just going to go through and fill everything out. So here you're going to want to select whatever reporting unit you are a part of. So I'm going to make it a little bit bigger. I hope you guys can see better now. Now I can even back up from my screen because I was kind of close to it so I can see. So I apologize for those that couldn't see clearly. So here I'm going to select, I'm going to select Phoenix Clinic, contact reason. Let's go to clinic. Priority. So this is like if it's a crisis or if it's just, hey, I'm requesting services. So I'm going to select normal. We would select urgent if it was a crisis or something of the sort. Contact is beneficiary. That is saying, is the person calling in the client, the person that's going to receive services? So I'm going to select yes. And from here, I'm going to kind of speed through a little bit. I'm not going to fill everything out, but like I said, it's best to fill everything out. If you have that information, get it in there. So I'm just going to scroll a little bit so you guys can see the different pieces of information that you can put in. Here, you can type in a note, client requesting counseling and medication. Okay. So now that I have all of my information put in, I can click submit here and it's going to submit the form. Okay, so once you're done with a form or a bundle, it's going to kick you back to the home screen. So that's an indicator that you've completed that bundle, that form, whatever you are entering in. Normally, I've seen it add whatever client you were working with into your recent clients box here. I'm not seeing that, so let's go ahead and search for Mr. iPhone here. Okay, so this is the one that was previously created, and this is the one that I just created here. I can tell that because this client right here has a P number, which is a temporary number. They're not fully registered into the system yet. So I'm gonna click on this guy right here, and it puts him into my recent clients now. You'll also see this information over here will populate with the client's information that you just selected. Let me see. From there, what you want to do is you want to assign a permanent MR number. So because this is a temporary number, you want to give him a permanent number. I have my forms over here kind of listed in order of the workflow. So that's something that you guys can do also in the edit. But I'm just going to go ahead and search it here again so you guys can see. So we're going to assign this client a permanent MR number. But first, before I do that, I want to show you guys something. So you can select and unselect your client here. If you keep your client selected while you go into a form, the system will recognize that you want to go into that form and enter information in for the client that you have selected. If you don't have a client selected here and you go into the form, it's going to ask you to select a client here. But since I'm going to have my client selected and I go into the form, it's not going to ask me to select a client. It's going to populate that client's information into that form. So that's just a way to do things more efficiently. Okay. In this form, it's a very simple form. All we're going to do is change the client's P number, turn the client into a permanent number or a permanent client rather than a temporary client. So click on Assign Permanent MR Number here. It's going to ask if you want to auto-assign next ID number. So for brand new clients, we're going to select yes. As you can see, it gave them this number right here. Do not click Assign Permanent MR Number again, or it's going to give them the next number and it's going to continue cycling through numbers, basically wasting numbers. So let's just make sure that once we've completed that step, you click Submit here. Because we've completed the form, it's going to bring us back to the home view. And we can see here that the client no longer has a temporary number, a P number. They have a permanent number. I know that saying a client's temporary number is a P number is kind of confusing because when you assign them a permanent number, it's not called a P number, even though it starts with the letter P. But whatever, that's just something that we're going to have to get used to. Okay, so now that we've assigned them a permanent MR number, we can move on to the next step of the process, which is filling out the mental health registration bundle. As you can see again here, I have it right here. There's two steps to this next process, because what we're going to want to do is we're going to want to create a mental health financial episode, and you're going to want to create the episode for the legal entity that you're a part of. So if you work for DBH San Bernardino County, the legal entity is 00036 SB County OP. First, we want to create the mental health financial episode though. So to do that, we're going to go into the admission outpatient form. Notice I have the client selected here, and I'm going to double click on admission outpatient here. This takes us into the registration of the client into the system. You'll notice that there's a lot more required fields here. Let's say the client is, you can type in the date of birth here. Let's do 07/05/1980. The admission date is today, and the admission time is current, so right now. Notice how I missed Social Security up here. So I need to make sure that I fill out the form in order. So I'm going to go back up and complete that. Now I'll continue with the form. Really? So you see this little message that popped up? It's telling me this Social Security number has already been filed for the following patients. So we're going to click OK, and we're going to change it. If you get that message pop up when you're using the system, it's going to be a trigger saying, hey, this client might already be registered into the system. So at that point, you'll want to stop and go back and do a client search again so that you can locate the client's previous registration. Right now, I'm in the test system, so it doesn't really apply here. So I'm just going to type in the next random number I can just put in. Here's where you're going to select what program you're creating or registering the client for. And remember, I said first, you want to create the mental health financial episode. We want to try to keep it consistent here. So always create the mental health financial episode first. That should be episode number 1. So let's click that. Okay. Notice this page break here that says CSI required fields. That tells us that this is a section of the first page of the form, and the CSI required fields is the next section of the form. So before scrolling down any further there, you're going to want to go to this side of the form and make sure that you fill out this side now. So the type of admission is a mental health admission because they're searching mental health services or seeking mental health services. Source of admission, you can select that there. I'm not going to select anything for this instance, but you can, why not? Okay, I'll select mental health there. The reporting unit, I'm going to put in 36B31, which is Phoenix. Admitting practitioner, for here you're going to want to select whatever clinician will be doing the initial assessment. You may not know that at this point. So if you don't know that, then you're going to want to go in and change it later on. In the test environment, it doesn't have our actual service providers' names. So I'm just going to select any one of them so that we can continue and move on with this. Again, if you know the attending practitioner, search them up and select them here. If the client is enlisted in any of these programs, you're going to want to select that here. And over here, seeking following services, this client is seeking counseling and medication. Now that I've finished that first section of the form, I can go down. Client's living arrangements, house or apartment here. Disabilities. If they don't have any, you don't have to put any on here. So notice I'm paging through different sections. And each section you can also jump to over here in the left-hand margin by just clicking on that. So it'll jump you to that section. Disabilities, now I'm on the disabilities. If I want to go back up to the top, I can click here and it brings me back up to the top. So you can navigate that way, or you can just scroll up and down. The compliance indicators here, all of this is required information. We should be obtaining this for every client as we admit them. So they're supposed to receive a copy of the beneficiary handbook. So click yes. They're supposed to complete the NOPP form or Notice of Privacy Practices form. So click yes. They're supposed to consent for outpatient treatment. So click yes. And here it's asking for advance directive. You can click yes or no depending on if they provide you with the advance directive information and if they have one. Many people don't have one. So you can click no here. Notice that once I clicked no, it grayed out the box right here. So if I click yes, then now this box is mandatory and you have to enter in the advance directive information that the client provides you with. I'm going to click no to save us some time so I don't have to make something up and enter it in right here. So from here, it'll ask for account number, ARMC Meditech number, and Case Explorer. If you work at ARMC or something, you might have the Meditech number, but in a lot of instances, it's not going to apply. So from there, I've completed the first page of the admission outpatient form, and you can see that right here. Now I want to jump to the next page because you can see that scrolling, I can't get to the next page of the form, which is demographics. So I need to click here to jump to demographics. Here's where you enter in all of the client's demographic information. If the client goes by a different name, you can put it here, and that will become a searchable field later on. Let's go like that. So I'm just going to go ahead and enter in their information here. Okay. When you enter in the client's zip code, it's going to automatically populate the city and address. So that's kind of a nice feature that it has that plugged in there. Let's put in San Bernardino County zip code. Bam. Beautiful. Okay, now I'm going to put in the client's phone number. Right here, you can put communication preference. This is kind of, I don't know, a weird field for me because I wouldn't really want to select regular mail as a way to communicate with a person. Maybe only in the instance that they don't have a phone. But let's just go ahead and skip past all of that. Here you have sexual orientation. Whoops. Notice that I have a page break here. So that tells me that if I keep going down, I'm going to go into the next section of the form. So I'm going to go back up and make sure I fill out this side of the form over here. So you can type in all this information, and if you have it, you should be putting it in. I'm just going to randomly select stuff so we can move on through this as quickly as possible. Okay. Now I'm going to continue scrolling down. Here, if the client goes by another alias, you can enter in as many as 9 of them. If a smoking assessment was completed, you can enter that in here. And if you're just registering the client, you're probably not going to have an FI code yet. So you're not going to have that information to enter in there, at least not yet. So from here, we can click to the next page of the form, which is other client data. And I'm not seeing anything here. So let's go ahead and click submit. And now we've completed the first registration into the mental health financial episode. At this point, you'll want to go back and create the next episode for DBH. So to do that, you're going to go into the MH registration bundle. Remember, we just completed the admission outpatient form so that we can register them into the MH financial episode. Now we're going to complete the MH registration bundle. So the first form in the MH registration bundle is the form that we just completed, the admission outpatient. Because what we're doing here is we're creating the second episode. We just created the MH financial here. Now we need to create the next episode. So it didn't automatically send us into the form. It brought us to what we call the pre-display. So it's telling us the different episodes that this client is already registered into. Down here at the bottom, you can click to add or edit. We're going to add, so I'm going to click here. Much of the information is pre-populated from the MH financial episode that we just created. So while it may seem kind of repetitive, at least it pulls over much of the information to kind of speed the process along. So I'm going to go through and complete my required fields that it hasn't pulled the information from before. Remember last time we did the MH financial? Now we're creating the episode for San Bernardino County DBH. So I'm going to select that one. Here, a box pops up telling us that they're already enrolled into an episode and it's the MH financial. And we're like, okay, we know this, we just created it. So we can click OK here. But if this box pops up and tells you, hey, they're already enrolled into a 00036 episode, then that's going to be a red flag telling you, okay, they're already registered into this program. I don't need to complete a new registration. Maybe I just need to go back and update some information in the previous one. Since this is a new client, they don't have that. We're just going to continue on. So as you can see, this is the form that we've already filled out. So we're just going to kind of breeze through it kind of quickly here, okay? So when we click on demographics to go to the next form, you'll see pretty much all of it's already populated from the previous episode that we created, which is great. Because now we can just scroll through and make sure everything looks good. And then click submit. When we click submit, it's going to take us to the next form in the MH registration bundle. The next form is the CSI admission bundle or form here. So right here, you're going to want to, again, enter in as much information as you have. Whoops. Okay, now I'm going to come over here. Is substance abuse affecting mental health? If you're the office assistant that is taking in the initial contact form, you may not know all of this right off the bat because this is some stuff that is going to be talked about during their assessment session. If the client indicates this information on the initial contact form, then go ahead and click on it here. But if not, you're not going to really know that at the beginning there. Whether or not the client is on conservatorship is a required field because that's very important. If they are on conservatorship, then only the conservator can sign and consent to treatment. So that's going to be basically a stopping point. If they are on conservatorship, you're going to want to then make sure that you get those consents and everything signed by the conservator. But our client, Mr. iPhone, is not on conservatorship, so I'll put not applicable here. Preferred language here is a required field. Here it asks you the number of dependent adults that the client cares for. And here the number of children less than 18 years of age that the client cares for. It pulled the CSI ethnicity from what we selected before. And here you can select up to 5 different races. I'm just going to select the top 3 so that you guys can see that it's a multi-select. Okay, I've scrolled down to the bottom and entered in all the information. Now I'll click submit to submit the CSI admission form. The next form is the program assignment. So those of you that are familiar with Simon might get a little confused here because the program assignment in myAvatar is actually what an episode opening is in Simon. So like when you pull up a 140 and you see a listing of all the different reporting units that the client has been opened at, this is the equivalent of opening them at those different reporting units. The 2 episodes that we opened previously, the MH Financial and the 00036 episodes, are the overarching episodes that will remain open. Program assignments will be opened and closed as a client is seeking services at a different program. So for today, we're going to assign this client to a program. This is going to be the opening date of that program. And we're going to open them at the Phoenix reporting unit here. If you have this information, like referred from, enter it in. But I think there's like a selection for self. Yeah, here it goes. Reason for evaluation or treatment, you can select that if these apply. Here, you're going to select the clinician that is going to be assigned the case. If you know the physician at this point, put that here. Under services desired, you can only select one of these buttons here. So what you can do as a workaround, because many of our clients will say medication and counseling, as well as case management, help with benefits, different stuff like that, you can click other, and then in this box you can type in all the different services that they're requesting. This client referred themselves, so I'm going to click self here. And this information is information that the client will check off on their initial contact form. So you can gather that there. Notice here, are you currently in mental health or alcohol drug treatment? It asks you, if you select yes, it's going to ask you where. So that you need to put that in there. If you select no, notice that it was grayed out. But if you select yes, it becomes an open field. So here, on the initial contact form, there's a spot where the client can write out what help they would like and why they're going to the clinic for services. So you can put verbatim here, like what they're putting there. That'd probably be the best thing if you can. If it's maybe profane or something, maybe don't put it verbatim, but just kind of summarize the services that they're requesting. Let's put it in quotations. Describe alcohol and drug use. Sometimes, I don't know, just to put something there. So you'll notice at the bottom of this form, it has a spot for you to close out the program. But we're opening them in the program, so we're not going to fill that out right now. You'll fill this out when the client gets closed out at the clinic or program that you open them at. But again, for right now, we're just going to go past that and click submit. That takes us to the emergency contact information, which is another form in the MH registration bundle. This client's emergency contact information is their mother. Yes, they live together. You can fill out the address and all that jazz. But over here, we're going to select mother. Okay. After you're satisfied that you've entered in all the correct information, click submit. And now we've completed that bundle. Again, you're going to know that because it kicked us back out to the home view. So we've completed every form within that bundle at this point. There's a few different ways that you can check if you've done this correctly. You can double click on here and it's going to open up the client's chart. And from here, you're going to see the different episodes that you've just created. Episode number, I can't make it any bigger right here. I hope you guys can see it. I have a question on the chat here. Sorry, I'm trying to focus on that also. Okay, so the question is, and I want to address it publicly, just in case someone else has the same question, is, are they getting the information verbally or inputting from paper? And I believe this is referring to the registration information that you get from the client. So we have created initial contact forms that the client will fill out, and then we will use that paper that they filled out to fill out the registration forms that we just did in myAvatar. So for the most part, it's probably going to be, you're going to receive this information from the client on paper. I understand that programs operate differently. Maybe some programs don't use the initial contact form. I haven't really heard of programs that don't use it. So I'm going to kind of just say that pretty much across the board, people are going to receive that information from the paper that the client fills out. Okay, so now I'm going to jump back over here to myAvatar. And if you remember, I'm going to close this out so I can show you what I did again. I double-clicked here on the client, and that opened up the chart view. So you're opening the chart. And again, you can see the different episodes that you've opened here down at the bottom. MH Financial should always be episode number 1. And then your second episode that you opened is San Bernardino County OP, which represents DBH. You'll see the admit dates that you opened them, which is today's date. Over here, you can see that the diagnosis is missing. We haven't gotten that far in the process yet. We're just registering the client. They haven't seen a service provider for the diagnosis. We can enter that in later after they've received their diagnosis. Over here in the left-hand margin, you'll see different selections. So these are going to be different forms and different information that has been entered for the client. Here you can click on Admission Outpatient, which is the form that we submitted twice, once for MH Financial and once for the 00036. And it has the client's demographic information here for the admission. You can scroll down and just check it out. Make sure you entered everything in correctly. Over here, you have the option to edit and print. Okay, so that's the admission outpatient form that we entered in. You can click on diagnosis. It's going to say no data found because, again, we haven't selected that. Up here, you can toggle between the different episodes that the client has. Now let's go down to program assignment. And this is where you're going to see the program that you opened them up at. We opened them at Phoenix. And you can scroll down to get a little bit more information. As you can see here, explain why you are here and the help that you would like. So we have that right there. Over here, all the information that we've entered in. So once you've verified here that you've done your admission outpatient and your program assignment, you can close out the chart. And other ways that you can check is you can have your client highlighted here, and you could go back into the admission outpatient form. Whoops, there we go. And it's going to take you to the pre-display, showing you the different episodes that the client is open at. So if you've done your openings correctly, they're going to show up on this pre-display. If the pre-display doesn't pop up, then you know that you have not entered in an overarching episode for the client. So if it takes you automatically into the admission outpatient form, that means that they do not have an open episode. But because we can see the different episodes listed here, we know that we did it correctly. Okay, So I'm going to go back out to the home view. And again, there's different ways to check if you've done it correctly. So I just showed you how you can open the chart and check the episode and the program assignment there. You can also do it by reopening the forms. So let's go and reopen the program assignment form. If the client has been assigned to a program, it's going to take us to the pre-display screen listing the different programs they're assigned to. If they have not been assigned to a program, then it's going to automatically open up the form. So let's double click here to open it. And it takes us to the pre-display with the Phoenix Clinic reporting unit here, showing that we did a program assignment there. So from here we can go out. I just wanted to show you guys different ways that you can check and make sure that you're doing your work correctly. So that completes the first section, initial contact log, and it also completes the second section, mental health registration bundle. Let me see. I kind of want to take a few minutes now for you guys to ask some questions, and I can walk through anything again and go over anything that you guys might want me to go over, just in case you missed a small piece of something. But I kind of want to open up the floor for that. So I'm going to pause for a second here and just wait for some questions to start rolling in. At this time, if you feel like you're going to have trouble communicating it through the chat, feel free to unmute yourself and verbally ask your question. Let's just be respectful of other people and try not to talk over them. Okay, I'll go ahead and pull that up right now, Jose. Whoops, I unselected him. Okay, so the first episode is going to be your MH Financial. And you'll see episode number 1, MH Financial here. And episode number 2 is 00036 hyphen San Bernardino County OP. I'm also going to type it into the chat, just so you guys can have it in the chat if you need to look back at it. You're welcome, sir. Do you guys have access to myAvatar right now? I think all of you guys pretty much should have access to it, right? No, Jose does not have access. Okay.
You should. I would suggest that you check your emails because your names were submitted if you registered prior to today. your name was submitted to IT.
Because another thing that you guys can be doing right now is checking your email and logging in and trying to go through the steps that we just did, so that you can see if there are any spots where you're having difficulty. And if so, then I can help you guys and walk you guys through it right now. Because we are running a little bit early, I want to make sure that you guys feel comfortable and confident in the information that we just went over.
If by chance you don't have an email from IT, please let me know. Email me so I can follow up. If not, Matt, we can always take a 5-minute stretch break in between the session if there's no questions.
Okay, that sounds good. Yeah. Let's take 5 minutes then. We're actually pretty early. Take 5 minutes, stretch it out a little bit, and when you guys get back, what I want to do is I want to show you guys how to edit forms and data here. Since we have a little bit of extra time right now, I can show you guys a few other little tricks in the system.
Okay, so let's return at 9:10, and then we'll pick up from there. Just give everybody a chance to stretch. Thank you. And Matt, I'm gonna pause the recording.
Okay. I strongly encourage you guys to ask questions right now while you have us available. So we have one here. Is the My Forms section customized? Mine doesn't have expandable admissions section. Okay, let me see if I can answer that and kind of walk you guys through it. So My Forms right here, you can customize it by clicking Edit here. So I'm going to click it there. It should pop up with this box, Edit My Forms. If you've never edited it, then it's going to be blank right here. And you're going to have to add forms by searching for them in this box right here. Okay. Is anyone following along with me on the Edit My Forms? Okay, great.
And Matt, can we also remind them that in the training environment, it may look a little different than the live environment?
Right. So the training environment there's quite a bit of information that's going to look different from the live environment. Eric, right now, are they in the live environment, do you know? Or did they get access to the training environment?
They should be in the train environment, but that's a good question. I'll double check.
Okay, so when you guys logged in, this might be hard for you to know, but if you were able to tell, can you tell if you logged into the live environment or the train environment? And the reason why I'm asking is because if you're going in and trying to create test clients so that you can go run through the processes with us, you're not going to want to do that in the live environment because you're creating fake clients in the live system, and that's no good. But if you're in the train environment, please feel free to mess around and to explore and get lost and then ask questions. Okay, but anyways, so let's go to the Edit My Forms. So when you log in, I think it's going to be like in your systems code. It should be like train UAT 36, something like that.
Can somebody forward me the email
UAT36MH.
Forms. For you guys that haven't edited at all yet, go ahead and look up initial contact log bundle. Double click on it to select it here, and you can add form here. If you right click on this section here, you can add folders, you can rename folders, and then you can organize the different forms that you add into different folders based on workflows that you do at your job. So I also had another question. Are we going to be going over MHS 140s? The answer is yes. You can see it right here in my reports. That's going to be closer to the end of the day, though. I'm going to scroll up through the chat and make sure I didn't miss anything else. Let's see. Okay, so there's different ways. I showed, there's a question asking, how can I see if I've inputted the correct episodes and program assignments if you don't have authorization to those forms? So I showed two different ways that you can view that, is by going back into the form and looking on the pre-display to make sure that they're listed. Another way that I showed is by double clicking on the client and opening the chart. I'm hoping that all of you guys have access to at least one of those two ways in searching out client information. So you can click here on admissions. You can go back to the overview and see the episodes here. You can go to program assignment and see the program that you assigned them to here. And the other way was by going back into the form and looking on the pre-display. And here you can check the different episodes that you've opened them with. That's a good question, Diana. I'm sure that there's a list of forms floating around somewhere. What I recommend is, as we go through this training, build your make note of all the different forms and bundles that we go through. So something that's really cool with the search forms is you can just type in a name of something and search for it, and it will pop up with a list of forms that are related to that search name that you put in. So let's type in diagnosis here. It's going to pop up with different forms that have that word in it. Another way that you can search forms listings is by clicking on this Avatar PM right here. And let's say we want to go into client management type forms, episode management. It's going to have all the different forms there, account management. So here are lists of forms that you can search out. I hope that helps you. I hope it answers your question at least. Cool. Okay. Let me see. Any other questions? We're down to our last 9 minutes here before the next section needs to start. Yeah, Margarita, the best glossary that I would say is by the browse forms that I just showed. Which is right here in Avatar PM. And then you can kind of just search it out and look for what form you need. Another thing that you'll notice is in your recent forms, so any forms that you've used or worked in during this login session will be tracked right here in recent forms. The same goes for recent clients, but it only collects this data per login session. So once you sign out, recent clients and recent forms will be erased. And when you log back in, it will start building those lists again. Another important piece of information is if you're editing my forms and you're creating all of these folders and making it look all pretty and everything, I believe it's not going to actually show up here until you sign out and sign back in. So if you've noticed that it's not showing up there and you're wondering what's going on, try logging out and logging back in. If no one has any questions, oh, cool. That's good to hear, Karina. If no one has any questions and if we have Karen here, maybe we can begin the next one.
Okay, you can get started.
Okay, so I'm going to use the same client that Matt did to input the insurances, or as Simon likes to call them, guarantors. So what we're going to do is we're going to go into the financial eligibility, and you're going to basically just add the insurance. So let me go back and go a little slower. So if I go fast, let me know, because I do talk fast. So you're going to highlight the client, go into the financial eligibility, and you're going to take the mental health financial, and you're going to go to the guarantor selection and hit add. You always have to hit add or it won't take them. You're going to input your Medi-Cal. And depending on whether you're in mental health or SUD, you'll pick the Medi-Cal mental health for mental health and SUD for any SUD clients. So for today, it's going to be a mental health client. You're going to, mostly you're going to always put no for customization. This is going to be the policy number is your SIN number, and I'm just going to make one up today. And for this, the billing number policy and the subscriber client number is always the same for Medi-Cal. Okay, you're going to put no, that you didn't verify it. Oh. It doesn't want to be cooperative today. Sorry about that. Oh my goodness. I never have this problem, sorry, when I use a real number. Okay, I'm just going to leave it blank for today. But it will always be your SIN number, and both billing policy and subscriber client index number will be the same. No, you didn't verify it. The effective date will be whatever date you actually register the client. So they were registered today, you can use today's date. And these subscriber assignment of benefits, coordination of benefits, and subscriber release of information all have to be yes in order for billing. And then we also have to have a county guarantor put in on all clients regardless of what type of insurance. And so this will also be county mental health. Customized is no. And this time you're going to put yes because you're automatically verifying that that is the correct guarantor. Today's date again. And yes for the coordination of benefits. And it always asks you to put them in order for billing purposes. So we're always going to bill Medi-Cal first, the county second. And you can put as many guarantors as you need to, whatever type of insurance they have. Sometimes clients will have Medi-Cal and insurance. You just add them and put them in whatever order they're going to be billed. And then you hit submit. And there's all our guarantors are in. And you can go back and double check. Sorry, I hit too soon. And for Medi-Cal, this is also where you're going to verify the Medi-Cal. So you're going to go into the real-time 270. And for training purposes, I can't really show you exactly how it works, but I can show you the process. Okay, you'll put in your client. You'll put in the episode number, which will be the financial. The guarantor is Medi-Cal. The request type will be generic, and you're going to verify it for today's date. And then you're going to hit process. Now, because we're in training, it won't bring up a report, but it will bring up a report, and the report will say whether it's active, not active, and you'll get that back. And once you get the report back, just make sure all of this will disappear and the post inquiry will be available, just make sure that you do post it so that Avatar will make sure, and your EVC number will be going into the financial episode. Okay, so once you've posted it and you come back into the financial eligibility, your EVC number, you'll double click on the Medi-Cal, and your aid code, your subscriber ID will come in, and the EVC tracking number will also show up, and the verified eligibility will go from no to yes. Okay, and once you put all that in, make sure that you go back into the financial eligibility, and you have to link the financial eligibility to the overarching episode. Whatever overarching episode you have, I know some of your contract agencies, it will show different than the outpatient, but make sure that the financial gets linked. You'll just hit your overarching, and you'll hit yes, and it pops up. Linking to another episode will erase. You'll get that the first time no matter which one, but make sure that whatever you're linking is always linked to the mental health financial, and just hit submit. Now, if for some reason you made a mistake and you went back and you linked to the wrong episode, it will take out your guarantors and you'll have to put them back in. So make sure that when you link, you always link the overarching to the financial. And is there any questions? Any more guarantors you'd like to see? Okay, I'm sorry, I can't see the questions.
I'll read it for you, Karen. It says that they may have missed where we can get the CIN, the SIN billing policy number. Where do we find that info?
You would have to use, if you don't have it from the client, you'd have to use either the Meds Light or the Stoplight system if you have access to it. Unfortunately, Avatar doesn't provide you with that information. Unfortunately, you have to tell Avatar what the SIN number is.
Any other questions that you guys will have around the financial eligibility? Now is the perfect time to ask.
I kind of throw everything out there, sorry. Already in here, so we'll put another insurance in. We'll go to the guarantors, and this one we'll put in Blue Cross. Okay. And you're still not going to customize. If you have the policy number, you can put that in. And this one, you would put yes, you verified it, because of course the client would have insurance. You would know that their insurance is good. And then whatever day you register, so today's date, and the self-client. So everything populates for you. Then you have to subscriber benefits. Coordination is all yes. Add the county. customize is no. Eligibility is yes. Okay, make sure that you put them in the billing order. And hit submit. And then for linking, you go back into the financial eligibility and just make sure that you do the overarching episode to the financial. So you would pick the overarching and put link yes and OK. And then make sure that right here it says MH Financial. If it says anything else, you want to go back and make sure that you're linking it to the right episode. And then just hit submit. And then that's it for the financial guarantors.
Karen, there's another question. They're asking, which button do you push for the overarching linkage? If you can show that again.
Yeah, that's back into your financial eligibility. And then your overarching episode would be okay. And it's this one right here, link to financial eligibility from another episode, yes. And then this is where you just want to make sure that you're linking the overarching to the mental health financial. And then you can hit submit. And it has to be linked in order for billing to go through. As long as they're linked, billing can go through. If it doesn't get linked, it stops the billing. So you'll want to make sure that the financial is always linked to the overarching.
Any other questions that you guys have for financial eligibility?
I know that was really quick. I don't know. I was looking through the guide. There's not really anything else.
You did fantastic. Thanks, Karen.
Ben.
Okay.
Okay, everybody. So in this section, we're going to be going over the mental health admission bundle. We're going to be using the same client that we did the previous sections with, so that at the end of the day, we can have this client completely registered with their financial information in, with their diagnosis and all that good stuff. So as you can see, I still have Mr. iPhone here in my recent clients. In my forms that I've organized, I have the MH admission bundle right here. But remember, if you don't have this organized yet, you can always search in this search field here. So it's called MH admission bundle. But let's say we're searching just by admission. See how I didn't start the search with MH and it still brought up MH admission bundle? I have my client selected here in recent clients. And now I'm going to double click here for MH admission bundle. Okay, great. So now it's asking you, what episode do you want to attach this MH admission forms to? Notice how MH Financial isn't listed here? Because that's not an episode that you provide services under. It only lists the 00036 episode because that's where we attach services and diagnosis and stuff like that to. So it's highlighted in green and we click OK. It's going to take us to our first form, the CSI admission form. Most of this information is going to populate from before because we've already completed this when we did the registration. So you're going to want to double check and make sure that everything is accurate and the same. If there's any updates that need to be made, you can do them now. Everything looks good because it's the same day that we did the last one. So we can go ahead and click submit here, which takes us to our next form of the bundle. First, it's telling me right here, you haven't made any changes. If you click OK to continue, this data will be included in the next CSI compile. If you do not intend to include this data in the next CSI compile, please click cancel and exit without submitting. Okay, thank you for notifying me of that. Let's move on to the next form. And this is the diagnosis form. The type of diagnosis that we're giving this client is going to be their admission diagnosis because it's a brand new client. When we click admission, you'll see that the date of diagnosis populates with their admission date. You can also select a discharge diagnosis if that's what we're doing here, which it's not. Onset or update. Sometimes we'll see update. Update is kind of a common one because sometimes things change, especially with clients that have been with us for a long time. So that might be something that you guys utilize in the future. Time of diagnosis, we're just going to go ahead and click current. Okay. In this next box here, it lists the diagnoses that we've given to the client. To start entering them in here, you're going to click new row. Okay. So the first one, I'm going to scroll back up. It jumped me to the next section, but I'm going to scroll back up real fast. You'll see that it automatically selected this as the primary diagnosis because it's the first one that we're entering. I'm going to scroll back down. I don't know what's a common diagnosis. Anyone want to toss one out at me? I shouldn't say common diagnosis. That's not fair. But does anyone want to give me one in the chat or anything? No? $300. Interesting. So in the search, you can type something into the search field here and then click the magnifying glass. It's going to pop up with a drop-down selection of everything that meets that search criteria that you entered into the field. And you could scroll through and select it. Select the one that you desire here. I'm just going to go ahead and select, I don't know, obsessive compulsive disorder. So we can double click on it here and it'll populate there. It's also going to give you the cross mapping over here from ICD-9, 10, and DSM-4. DSM-5 right here. Diagnosing practitioner. So this is going to be the doctor or clinician that gave the diagnosis. When we look over here on this side, we can see an estimated onset date. If that information is given to you, enter it in. It may not be given to you though. And the resolved date. So because we're entering in this diagnosis, we're not going to really have a resolved date for it. I'm not saying that that's always going to be the case. You may, but for this instance, we don't have a resolve date. So for ranking, you can see that it automatically selected primary. That's because up here, it's our first diagnosis that we're entering in. And you'll also see that once we selected that diagnosis, it populated that diagnosis information here. So from here, what we can do also is give multiple diagnoses at the same time. To do that, you would want to click new row here, and you'll see, okay, so every time we do that, it automatically jumps us to the diagnosis search. I'm going to scroll back up. You'll see that it gave us our second line here. You'll also see that the bill order down here, it automatically selected 2. So let's select this one as our second one. I double click on it. Again, you'll see the cross mapping pop up. We're going to keep the diagnosing practitioner the same. Let's scroll down a little bit. The ranking for this one, we can select secondary. So you can make the order all the way up to tertiary, but you can add more than 3 here. So now that we've done that, we have everything looking good. We can click submit. Let's check out this second page we have here. Pretty sure there's a couple pieces of information on there that we need to add. So let's click there. So here for trauma, you can click yes, no, or unknown. I'm going to click unknown there. If there's substance use involved or abuse involved, you can select that here. The reporting unit here. So I'm going to type in Phoenix because that's where the client was registered to. If you have this information here, you can enter it in. You may not, and it may not apply. Okay, so now that we have all of our information selected, actually I'm going to click no so that I don't have to worry about entering in anything here. Under substance abuse, I'm going to click no. I'm going to go back to the diagnosis page, just give it a quick overlook, make sure I didn't miss anything. It's always good to do that before you click submit. Good practice. Okay, everything looks good. I'm going to click submit here. Here it's asking me if I want to return to the pre-display screen. You guys remember what the pre-display is, right? It's the screen that shows us the listing of the different episodes. So if you click no, it's going to take you to either the next form or it's going to kick you back to the home view if you're done with the bundle and the forms. So let's go ahead and click no because we don't have anything else to input there. And see how it takes us to the next form in the bundle? This is where we can enter the SOGI information. Does anyone have a question? I think I heard someone speak up. No? Okay, well, if you want to go ahead and mute yourself if you don't have anything. And if you do have something, go ahead and type it into the chat right now. And we'll address it as soon as possible. Okay, so here's, you can enter in the SOGI information. Notice none of it is required. So for the purposes of just moving along, I'm going to go ahead and just click submit on this. Okay, next it takes us to the prevention and early intervention. This applies to certain programs. Not every program is going to have stuff.
Hear anything?
So if this doesn't apply to okay. So if this doesn't apply to your program, you can just X out of it and it'll take you to the next form. Or if this is the last form of the bundle, it'll kick you back to the home screen. So as you can see, it's all required fields here. So if it does apply to your program, you have to complete it in its entirety. I'm just going to X out of it. If I X out of this form, don't worry about the other forms that you have completed and submitted. You're only Xing out of this form. So all the previous information in the bundle has been saved. It's only this form that you're closing out. And as that was the last form of the bundle, it took me back to the home view. So now let's double check and make sure we did it correctly, right? Because that was quite a bit, and it's always good to double check your work if you have time. If not, sometimes it's good to make time to double check your work. So right off the bat, what pops out to me right now is down here in the client information widget, I see the diagnosis right here. And that's the first one that we entered in. So already I can feel pretty confident that, that it was entered in correctly. You can also double click on the client's name there and open up the chart view. Right here, you can go over to diagnosis here. And also, remember over here it said missing diagnosis? Now we have our diagnosis down here. Let's come over here to diagnosis forms. And now we have all that information that we just entered in. And you could double check some of the detailed information on it to make sure that you entered it correctly. And here's the information from page 2 that we entered in. So it looks good. It looks like we did that correctly. Let's close out the chart. So if we also wanted to double check and edit, you don't have to go through the whole bundle to do an edit. You can just pull up the one diagnosis form. Remember, bundles are a collection of forms to help you complete a whole workflow. If you don't need to complete the whole workflow and you only need to do an update, you don't need to go into the bundle. You can just search out that form individually. So let's keep our client highlighted here and go into the diagnosis form. So this was just one of the forms that was in the MH admission bundle. It's going to take us to our pre-display here, and we entered it under our 00036 right here. So let's click OK. And this is the admission diagnosis. Now, if they have multiple diagnoses entered in for multiple programs, this is where you're going to see a listing of all of those. And to make sure that you're editing or making any updates to the correct diagnosis, you're going to want to check out this date over here. We know that this is ours because this was our admission date. This was our diagnosis that we gave them. So if there's a long list of diagnosis on here, you're going to want to be very careful on this screen and make sure that you're updating or editing or anything the correct one. Okay, Diana, I'll go back and go over that again real quick after I take a look at the diagnosis here. Okay, so see how it brought us to the diagnosis? And this is where we can go ahead and make updates and stuff like that. So the first one right here, you can change that from primary to secondary. You can add new diagnosis. You can resolve them. You could void them out even. If one was entered in incorrectly, you could void it out. I just wanted to show you guys how you can get back in and do those updates and the process in doing that. So I'm going to go ahead and close out this form. Are you sure you want to close without submitting? Yes, thank you. And now I'm back in the home view. Okay. So to open up a chart, you can just double click on the client here. Okay. I didn't like my double click the first time. And now I'm in the chart view. To exit back out of the chart view, you just click this little stop sign X button right here. Bam. And now we're back in the home view. There's some different stuff you can do in here also. You could refresh it. Let's say someone just entered a form in or did an update. You can refresh it so that it will show viewable here. I think you can pop it out too. Yeah, I see. Now it's popped out. I don't know if you guys can see that. But now I have the chart in a separate window. I'm going to close it. Okay, didn't like that. Let me think. Well, that is the MH admission bundle. I'm not sure how much time we had for this section. Let me double check. Okay, great. We're a bit ahead of schedule, so I'm gonna open up the floor again for any questions. If you guys are in the test environment, please create a client. You can take a little bit of time to create a client and go in and go over those steps right now.
Everybody remembers how to enter in a client and start with the initial contact log? Bundle, sorry. Matt, you got it covered. You and Karen are awesome.
Yeah, I guess so. Hey, like, do you guys want me to like deliver some go around and deliver some Starbucks to each of you? No, I'm joking. I'm just looking for some questions that I can answer. No questions? It's pretty straightforward. The system's actually pretty easy to use. And the more you use it, the more comfortable you're going to get with it. All right.
Matt, then I'm going to pause the recording and then allow time for people to enter in clients and do the financial and see if they have questions.
Okay, I'll stay on standby.
Okay. All right, whenever you're ready.
Okay. So we have a question in the chat. How do you open a financial episode? Because the client they created is they only have the 00036 episode created. So we really want to make sure that we're creating the financial episode first, But let's say that there is an error or something happened, and for whatever reason, you created the 00036 first. And now you need to create the financial episode. The way that you want to do that is look up your client. You can have them highlighted here. And you don't have to do the whole mental health registration bundle again. You only need to complete the one form inside of that bundle to create an episode. And that form is called admission outpatient. You can see it right here in my forms that I've edited here, but you can also look it up right here. So admission, and you'll see it pop up right here. Double click on it to open it. So for my client, it's going to show MH Financial episode and 0036 episode in this pre-display. If you haven't created the MH Financial yet, you will not see that episode here, and you'll want to click Add down here at the bottom. You'll see much of the information populate, and this is where you're going to select creating the MH Financial right here. So to create the MH Financial, you just select it. It should be all the way at the bottom. There it is, like that. And then you go through and you fill out the required information, fill everything out, and then submit. And that will create the episode for MH Financial. Since mine already has one, I'm not going to follow through with creating it. I'm just going to X out of this form. Okay, so I'm going to go over it really fast again. Have your client highlighted here. Go into the admission outpatient form. It's going to take you to the pre-display that has the different episodes that the client is opened with. And you're going to add. And under program here, you're going to select all the way at the bottom, MH Financial. Go through the form and click submit. Alrighty, Jose, I'm going to give you a quick sneak peek, okay? Because we're supposed to go over the 140 later. But, I mean, it's just so simple. Like, go to search forms right here. Type in 140. You'll see client face sheet MHS 140 pop up, and you just open it. Yeah, it's pretty cool because you can view it without having to print it. So in Simon, you had to print it, but here you can just view it. You can print it if you want to print it. One of the things I like about this system a lot is that these reports are on demand. So kind of like, I don't know how many of you are familiar with like the 902 report. It prints daily in the morning. It's automatically done. But in this system, you can demand to view a report at any time of the day, and you can have access to it so long as your user role has access to that report. Okay, sure. Okay, so I have my client highlighted here. If you don't have your client highlighted there, that's okay too. But when you pull up the face sheet, you can type in face sheet. You can type in any of these words or phrases or anything to pull it up. Notice I don't have my client highlighted over here. So I'm going to double click here to open it. And it's going to ask me to select a client. So there I'm going to select my client, double click there, and now it's going to pull it up. So at this point, you can also change the client that you're looking up right here using this. But this is the client we want to pull up, so I'm going to click process right here. Okay, it takes a minute for it to load. Anyways, I'm going to go ahead and close it out because we're jumping way ahead. Let's say you want to do multiple 140s. You click yes here, and it'll bring you back to this form. Do you guys have your clients created and all that? Hello, hello, hello.
Okay, it's all yours.
All right. So I am going to walk you all through discharging the client. So I'm going to use a different client that I created this morning, other than that's Mr. iPhone, just in case he still wants to use the computer. So here is Mildred Whitney's. Okay, so I'm going to walk you through closing a client that is open in your program. Keep in mind that because all DBH services fall under the 00036 San Bernardino County episode, we do not want to discharge that episode. What we are actually doing is discharging the client from the program. There are situations where you would discharge this episode, but it only if it falls under these circumstances. If the client has not received any services for 90 days, if the client has moved out of state, or if the client has deceased. Having said that, for our DBH programs, to discharge or close our client, we would do so by just simply completing the closure portion of the program assignment form. So what we can do here, I've selected Mildred Mittens, and I'm going to open our program assignment form. I have it here under my saved forms, but yes, you can also search for forms and open it that way. So here's the pre-display. Mildred is open in 2 different programs. However, I want to just close her in this particular one. So what I would do is highlight to select, go down here to click edit, and you see it's open with our CCRT team, who's our clinician. All this populates from the admitted one. So I'll just scroll down to the program closing section and fill in, let's say we're closing here today. We usually get this information, the program closure reason and referred to. They usually come to us in codes. I'm sure you're all aware of it. If you go to the internet, you can actually see episode closing and opening codes. I just have it pulled up right here. Can you all see this one? I'm going to keep your silence as a moment. So here's your codes, reason for discharge codes. So we have all our referral codes. So that will aid us in filling out these sections. And they coincide with all these prescriptions. So mutual agreement, part reached. Let's say this person referred to himself. And that is it. That is actually how you close the client that is opening the program. You hit submit. So what we can do, like Matt said, it's a good practice to always double click your work. You can double click on Mildred to open our chart. From here, we can look at the program assignment. Currently, she's still open with this one program, but if I go to consume, you can see that I have closed it successfully. If I X out, I'm going to go back to my home view. Additionally, I can also double check by going back into our program assignment form. In this pre-display, you'll see now that there's a program ending. So there is a bundle that you can use for closing a client. This bundle is called the MA Prescribe bundle. The reason why I discourage, when I'm training, I discourage the use of this one because it takes you through two forms. It takes you through the assignment form, and it takes you through the discharge form. This discharge form will discharge your San Bernardino County overarching episode. If you find yourself in a position where you do need to discharge this episode, I can walk you through it so you can see. I'm going to open the form just on its own. Here's the discharge form. Again, here's a pre-display. It's going to ask which episode you want to discharge. We're never going to discharge an MA financial. So let's say we select that one. Say OK. Everything in red, of course, is required. So episode 2 is indeed our San Bernardino County repeat. Let's say I'm discharging today.
Anne-Marie.
Yes.
Some people are having a little trouble hearing you. I don't know if it's your connection.
Oh, I'm sorry. My computer's fan has turned on, so I don't know if that's affecting anything.
Got it.
I'll try to speak up a little. Do you need me to go back over anything because of this? You can let me know.
I'll leave that up to them.
All right, no problem. So again,
but please let us know, guys, if you do. If there's some part that you missed because you couldn't hear.
Yeah, I'll be happy to go over it again. Like you said, we're way ahead of schedule. So.
All right, thanks, Amber.
Yeah, no problem. So I will fill out all that is required. Our practitioner, type of discharge. Like I said, we would discharge this episode only under those 3 following circumstances. No services for 90 days. Client has moved out of state. The client has deceased. If deceased is actually the reason, once you select that, date of death, reason for death becomes full of it. If you select something else, client moved, then that grays out again. Any further information can be captured here. If there are any changes in demographic information that you know of, then click on your demographic link there and change anything you need to. And then you would submit. I will not submit because I don't want to close this episode. So I just want to show you guys what this form does look like. So I'm going to X out and close without submitting. So that is discharging, closing the client from the program. Is there anything you need me to go over for that portion? Okay. It's pretty straightforward. Like I said, closing your program, just using that closure section, it's probably the easiest closing. It's easier than signing.
Jose, I saw that you had a question. Did that get answered? We do have a little time, so if you guys do want her to go through it again. Someone is asking for yes.
Would you like me to go over the bundle,
yes.
like discharge bundle?
Yes.
Okay, why don't I do that? So,
all right, thank you.
I might have a client from before that I could use. Let's try Tomo Sushi. So I highlight Tomo. I am going to discharge, close Tomo from the program and discharge her from the San Bernardino County episode. So I'm going to highlight Tomo, and I'm going to go to your MH discharge bundle. Well, Tomo's not a good example because she's closed in everything. What I can do is open and close same day, just to kind of go through those steps that I'm closing her. Some programs do open close same day, so this could be relevant to you. So, for example, West Valley. Use the same permission. So I'm going to close Sushi same day. I'm just going to scroll down to program closure information. Click on T for today. Program closure reason. We can say it was partially reached. And then we'll refer to just further inside. If you have further information, you can definitely fill that in. If not, this is all you need to close the client within the group. So I will submit this form. And this is a bundle. So like Matt had said, it also bundles take me to the workflow. So now what this bundle does is take me to the discharge form. I'm going to discharge the San Bernardino County application episode. So I'm going to click OK. Date of discharge. I'm going to say today. Okay. Sometimes when those warnings come up, it can be bypassed. It's just kind of, they want to make sure you're confirming the community. This is our current time. Type of discharge. So the client moved. And I can submit this form. So now if I were to open Tomo's chart, you'll see that the only open episode that she has is in the here in the top right. And you can see there's a discharge date now for the San Bernardino County episode. That's my MD. Are there any questions? No? Well, I can move on to the next part, and if you think of anything, you can write it in the chat, or you can open it up after this section. So I am going to go over client information with you. So say if you have a client come back, they already have information in Avatar. You just want to update some demographic information. So I will walk you through that. I'm going to select one of the names. We do have a bundle. It's called Client Update Bundle. What this bundle does, it takes you through the update client data form and financial eligibility. You can use this bundle if you do have demographic information update as well as insurance information. So let's go to client update bundle. Our first form is update client data. As you can see, it's very similar to the demographic section of the admission outpatient form. It's already populated with all the information, the existing client information. So here you can add more, maybe Mildred, likes to go by another name now. Right? Or change the address. Anything you can update right now. So let's see. Next is taking us to financial eligibility form. Here's a clean display. Of course, anything that is insurance or financial eligibility related, we change on the image. So you click OK. And it opens up this form, which we have seen before. If you go to guarantor selection, you'll see she already has Medi-Cal. If I need to edit anything here, you would select the guarantor and go to edit selected. This is now where you can either add information, if anything has changed. Maybe I looked on the stoplight page and found her SIN number, and I can put it in here. And if there's nothing else to change, I submit. And that is updating client data. Again, there is a bundle. You don't have to use the bundle. You can go to each of those forms individually. If you don't have any financial information to update, you can just go straight to update client data. Any questions? Very straightforward. All right. Next one. Client condition pregnancy. So this form is to enter information on client's pregnancy, obviously. What you would do is highlight again your client's name.
Hello.
Hello? Can you hear me?
Oh, sorry, Anne-Marie, that was me.
Yeah.
I accidentally hit the mute.
I was like, oh my gosh, I'm talking to no one.
No, that wasn't me. Because I was about to say if anybody had, when you said questions, but I didn't take myself off mute. So my apologies.
No worries. Okay, so we are doing client condition pregnancy. One thing to point out, in the train environment, this is client condition pregnancy. In the live environment, they have changed the name of this form. It is now known as Women's Health History. The live form has more information than I'm about to bring up. However, this pregnancy portion remains the same. So this is what comes up. Of course, it's only applicable for female clients. So you would see that client is pregnant if it's indicated. Where we get the information is indicated on our CDI. You might have more information than that, especially if you're in an outpatient clinic. So say Mildred is expecting. Once you select one of these three, then these become required fields. So I will enter Mildred. Episode number is R36 outpatient. Our selected record. So a pregnancy start date is an estimation. So this would be the estimated start date for the client's pregnancy. Pregnancy end date. Now, this is not the anticipated due date. You only fill in this field if you know the date of the actual date. Like I said, this form looks a little different in live environment, but this portion of pregnancy information remains the same. So submit. Do I want to return the form? And that is client information pregnancy. Again, very straightforward. The next form we're going to go over is client contacts. When we were in our registration bundle, you were brought to your emergency contacts form. Sometimes the client might just have contacts that aren't listed as emergency numbers, maybe a spouse, a parent, and this is where you can actually put them in. So I've highlighted Mildred. I go to client contacts. So a client can be, a contact type can be a client or not. If they are a client themselves, a client ID becomes required. If it is a non-client, that grays out. You can make a contact status active or inactive without having to delete the record. So they're active as of now. Let's put in a mother. Say other. Is she an emergency contact? No, she's not. So her name is Mars. Enter all information that you do have that's appropriate and relevant, and submit to file and save. Do I want to return a pre-display? If you have more contacts to add, let's say yes, what it would look like. There she is. You can add another one, or you can edit. By canceling, it brings me back to home. Any questions? Nothing else you would like me to go over or repeat?
Can't emphasize enough, this is a perfect opportunity for you guys to ask any and all questions. Anything you're unsure of, anything you think you need to see, anything you've already been seeing and hearing in the clinics that you want us to take time to clarify or answer. We want to make sure that when you leave the training that you guys have a good understanding. I know it's different when you actually get in and you're working with live clients, but we want to try to address and answer as many questions and concerns that you guys may have right now. And you are super quiet, but
indicator. If the service is requires a pregnancy indicator, please complete client.
Matt, remember it's not updated in the train environment. Remember there's a new form for the pregnancy indicator in the women's.
Right. It's
I'm drawing a blank.
and I think Anne Marie briefly went over that. I thought I heard her mention that when she was doing her section a few minutes ago. So in this training environment, it's going to look like this, but this is incorrect. There's a different form, and I'm drawing a blank on what it's called also, but after I submit this service, I will find it so I can show it to you guys. Oh, thank you, Anna. I just saw that pop up.
Women's health, yeah, there's Anna. And if we can then do it from the beginning so that to make sure I have a clean recording of you doing this without me interrupting, I apologize.
Okay. Do you want me to like erase all of this and go over it?
It's up to you, or if you want to do another one.
Yeah, I'll probably just do another one. Okay.
Okay.
That would be nice, Sarah. It'd make it easier on the people entering in the services. So the question is, I've heard from OA staff that Avatar only takes time in minutes. Should clinical staff change CDI submissions from hours and minutes to only minutes? So that's going to be like a different type of change that's program based and based on what the clinic soups and all of that decide if they want to make the change there. Simon also, I believe, was only minutes, if I remember correctly. The OA staff have just been converting it on their own. Anyways, I'm going to go ahead and submit this service. So it's telling me submitting has completed. Do you wish to return to form? So the way that this is going to be really helpful for people entering in client charges is if we click yes, it's going to keep us in this same form and just erase everything that we've entered in. If we click no, it's going to kick us back to the home view. So if you have multiple services to enter, you're going to want to click yes right here. Let's go ahead and enter the next service for this client. It's going to happen today. Oops. We're going to select our client here. In the client ID right here, you can search for the client by the last name, comma, no space, first name, or you can search for them by their client ID. Next, we're going to go down to episode number. And remember, we're not going to enter services into the MH Financial. We're going to enter our services into the 00036. So make sure you select that one. The next field to select is program. I'm going to enter the service into Phoenix Community Counseling. And again, just to reiterate, make sure that you are selecting the correct reporting unit here. Some of them are very similar, and you just want to make sure that, that your billing is entered in accurately. So let's say the client just did their 331 assessment service, and next they have went in to see the doctor for their psych eval. So we're going to enter in the service code for that, 364. Over here, we're going to select the practitioner, who is the doctor. And we've been using this Agnes Petersburg, so let's go ahead and select that person. And it doesn't like that. I guess Agnes Petersburg is not a doctor. So it's telling me that right now. It pops up with that little warning. The Agnes does not share a common discipline with the following services. So we're going to click OK. Looks like we're not going to do a test for psych evals. Let's just go ahead and enter in another assessment code. Keep in mind that if you have same day services and they're the same code, you're going to want to enter in your duplicate service codes, which is your 77, your 76. So make sure that you're doing that if you're entering in same day services, multiple service entries for the same client on the same day. So because we already did an assessment for this client today, I'm going to enter in a multiple service code of 77 here. Alrighty. So let's select our clinician who's going to do another assessment today. Duration this time, it's going to be much shorter because she already spent 90 minutes with her. So let's do 45 minutes. If there's a co-practitioner, we can enter that information here. Let's say the co-practitioner was only there for 30 minutes. You can change the amount of time for the co-practitioner there. And the same goes with a second co-practitioner. So if there's multiple people helping out with that service, then you can go ahead and use those fields right there to identify that. So as you can see right here, the cost of service is half as much as it was for 90 minutes. So we don't have to estimate what the amount of service is there. Just make sure you're entering in your service code accurately and your duration, and it will calculate it for you. Scrolling down again, if it's evidence-based practices, make sure you make that selection here and here, depending on what is suitable for that. For this one, I'm going to click submit. Okay, after this, we are going to go into the edit service information for this service right here and mark an emergency indicator. So let's submit it. It's going to kick us back out to the home view if we select no right here. And that's what we want, because we're going to go into a different form, the edit service information form. So I'm going to have my client highlighted here. You could search it up, edit service information, double click to open the form. And on this form, I don't think it really matters if you have your client highlighted, because see how it's still blank? It wants you to search inside of the form. What was it, 4012? Yeah. Okay, so we're going to select the episode number 00036. And this is where you search for the service that you want to edit. So the service that we want to edit was done today. So let's enter in our search parameters by selecting today and today. Service selection default. We don't have to select that right now because these search parameters are going to be sufficient enough. There's not a whole bunch of services. Let's click on select services to edit here, and it pops up with both of the services that we just entered. So let's edit both of them. Click OK. We're going to go down and select emergency indicator right here. And this is where we're able to do that, where it said on the client charge input that we can select emergency indicator. Here it is. You can scroll through and take a look at everything. It's pretty much the same thing as the client charge input form, except anything that we put on this one will update that client charge input. So that's why it has pretty much all the same fields, just in case you need to edit any of those fields. Since this is the only thing we're editing, we're all good, and we can click submit right here. Submitting has completed. Do you wish to return to form? We can select no right here. Alrighty, so that is for direct services. We also have indirect services. These are services that are more for tracking a service provider's time. And we would use the same form for this. So we're going to go back into the client charge input. Let's say the date of service is today. Notice the client ID is not a required field. That's because we use this form for both direct and indirect service entries. If it was a required field, we would only be able to enter direct services here. Episode number is not required at this point because we didn't select the client here. Under program, you're going to want to select the program for indirect services. And I don't know, let's do 431. And the practitioner is going to be the same one that we've been using, Agnes Nelson. And she did 2 hours, well, not that, 120, 2 hours of adult treatment support. So that's pretty much it for an indirect service. At this point, you can click submit. Submitting has completed. Do you wish to return to form? And we can select no. And it takes us back out to our home view. So women's health history is the next thing that we need to touch on. Mr. iPhone is a Mr. So it will not allow us to do a woman's health history on Mr. iPhone. Did anyone create a female client? Nope, not hearing anything, not seeing anything. All right. Maybe I can use this one. Who's this? Lily Collins. Okay, let's try that. Okay, so I saw this client right here in this widget, so I'm just going to use that one. And now I will go into the women's health. You know what? It's not going to show up on this. That form wasn't created in this one, so I can't really showcase that right now. Let me see if I can log into the live system real fast. I better not, actually. We don't want to use the live system. But anyways, so to indicate pregnancy, you would use the women's health history form. There's a section closer to the bottom that has a spot where you can indicate the date that the pregnancy began, and that will trigger that the client is pregnant. That covers both direct and indirect services. Do you guys have any questions for me?
Any questions? I know I got a couple of private chats that said that they did create clients. If you guys aren't sure, like I got one that said they're not sure, now would be the time to give us the client number, and then Matt can go through it and we can double check. So if you're not sure that you entered it in correctly, now would be the perfect time for us to take a look at it before lunch. You either just unmute or type in the client number or name and we can look it up. Matt, did you see the question? If a mistake was made on one of the codes, can they be edited through the edit service info?
Great question. Yes, it can. So let's go back into the edit service information. Notice how I highlighted the client even though it doesn't matter. I've made it a habit of always highlighting the client because it helps me get through the forms quicker. Anyways. Okay. So for Mr. iPhone, you can see that service code is a field on this edit service information. Because it's a field on this form, you can update that service information. Select today. Okay, let's edit one of these. So right here we have 3317. I wonder if 560 will let me do a 17. I'm gonna give it a shot here. 56077. No, it doesn't. Okay. Just for the sake of showing that we can change the service code, I'm not gonna put a duplicate service 77 on there. I'm just gonna leave it at 560. So now we're changing that 33177 service into a 560 service. And I'm gonna click submit. The duration was 45. You're gonna wanna make sure you double check that the duration is the same. Submitting has completed. So it just let me switch the 33177 into a 560. So there's several different ways that we can view build services. One of the ways is the next section that we're going to be going over when we get back from lunch. And another way we'll be going over later in the day when we go over crystal reports. So I'll show you guys how you can do that when we get back from lunch.
Matt, I'm hearing silence, so I apologize. I got a call from IT I had to take.
Yeah, no worries. We're good. We're good over here.
Oh, okay. And I do have a couple of, even though I just realized that I know that the women's health form isn't in a train environment, but I do have a couple of female clients. If you just
Yeah, I noticed that too, and I was going to switch over to live, but then I was like, no, let's not share PHI in a trade.
yeah, good call. Did you want to pull up the client, a client or two, to take a look at?
Yeah, I was gonna use this Lily Collins right here to
Oh,
do
okay, go
that,
for it.
but I can't pull up the woman's health on this system anyways.
Yeah, that's true. But I mean, if you just want to check, at least we can maybe just have them check a couple of clients because a couple of them indicated they weren't sure if they did it correct.
Oh, I got you. Okay. Yeah, I can check that to see if people want me to check on if they're entering in episodes and services and all that good stuff, I could check on that.
And Sarah, I'll go ahead and answer your question. We'll do build services after lunch.
Services that have been entered for a client. So I'm going to highlight my client here and then come over to search forms and select client ledger. Double click on it to open it up. It looks like this is another form that doesn't pull the client's information if you have them highlighted. So we'll have to go ahead and enter it in again. So after you select that, you can select what information you want the report to bring up. And we can go ahead and select all episodes here. See how it automatically populated the dates here? Since this is the only date that the client would have services entered for. You can select the episode number, but since we put all episodes, it's not allowing me to click on that. If you select episode here, then this becomes a required field. And you can select your episode. And again, the from and to dates pre-populated because this is the only date that the client could have services since we opened them today, August 5th. If we come down here, you can select the ledger type. So this is the type of report that you're going to be bringing up. Crystal reports are a little bit more in depth. They have hyperlinks that you can click on to bring up more information. The simple report is exactly that. It's more simple. So let's go ahead and bring up the crystal and then I'll bring up the simple report so you guys can see the difference there. I'm going to select crystal and process. And here we see the two services that were entered in. Anything blue is a hyperlink. See how the cursor changes when I hover over it? Okay. So it has the different columns of information with the header telling you what is going to be in that column. Let's click on the client name here, and it brings up demographic information. What it also does is it creates the tab up here when you click on the hyperlink so that you can toggle between the two. Diagnosis history. Now we have a new tab up here, diagnosis history. Graph of charges and payments. So this is the client ledger. This is where you can check the services that have been entered in for the client. As you can see, this is only for the one client. It's not going to pull up services for a whole reporting unit or program. It's only going to pull up the services for the one client that you select. Okay, I'm going to go ahead and close it. And right here, it's asking me if I want to return to the form. I'm going to select yes, so that I can enter in the same information, but select simple report here. See how it kept all the information? That's kind of nice, because now I just get to click simple and process it that way. And as you can see, this report is a lot more simple. It has the same information that the first page has, but it's lacking hyperlinks. And it's lacking some of the detailed information that the Crystal report had. Down here, you can see different selections that you can do. You can print the report, you can dismiss it, you could file it or save it. Another thing to notice is that it didn't open this report in a separate window. The Crystal report opened it in a separate window, but this is still within the myAvatar main window screen. So you have to dismiss it here to go back to the myAvatar home view or form that you were in. Whereas before, you can close out the window on the Crystal report to go back. Processing report has completed. Do you wish to return to form? That's it. That's the client ledger. I'm going to click no and give you guys a few seconds to see if you have any questions.
Hi, Matthew. I'm new. So I have some questions, if that's all right.
Okay.
Okay, so the Crystal report, who gets that? Who would want that?
Um,
And that's just for viewing, right? Like if I had to go up and say, oh, what did this person have? Boom, 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 type it in. I don't necessarily have to print that out unless they request, can I get a printout of everything the services that I've had?
right. And more than anything, it's for informational purposes on the back end for office staff.
Mm-hmm.
I don't really see us sharing those Crystal reports with clients.
So would the other one, that's not a Crystal report, would that be something you would give to a client?
I don't see a purpose in that because we can pull up services using other reports. Like if the client is asking, can you give me a list of my appointments? We can
Mm-hmm.
pull that up and it will have like what type of appointment that each of them are
Mm-hmm.
without like the client ledger will have information that the client doesn't necessarily need, such as cost of service. If Medi-Cal is being billed, I don't see where that would be beneficial for the client to have. I'm not saying that we would restrict the client from receiving that. I think that's more of a compliance question. So we'd have to check with them to see what reports we would be able to release to the clients.
Mm-hmm. And then if I wanted to see a group, and this is just for, again, for research, like for the back end, if I wanted to see, if somebody asked me, oh, I want to see a list of all the clients that received this service for this month, is there a report that I can print like that?
Yes, so that would be the direct service verification report, and it has different different search parameters.
Mm-hmm.
And
Oh, you don't have to do it. I was just wondering. Okay, thank you.
You're welcome.
Mm-hmm. I think there's some questions in the chat.
Okay, let's see. Okay, Sarah. So not all of the computers have the report viewer installed in them. So if you're unable to open a Crystal report, you're going to want to submit a ticket to get that installed into your computer. You should include the blue tag for your computer in the ticket that you submit.
How do I know if I don't have it? Does it just like do nothing or just go back to the screen?
When you select Crystal Report and you go to process the report, it will have a message box pop up saying report viewer cannot be found.
Thank you.
You're welcome. Okay, I'm going to go ahead and answer Karina and Jose at the same time. Is there a way in Avatar to bring up a report that shows the name of the staff that provided the service? And then also here, Jose says, is that the 902? So the report that we just did is not the 902, but the 902 is called something different now. It's the direct service verification, input verification, I'm sorry. And we will be going over that later in the training when we go over Crystal reports. That will show the name of the staff that provided the service, and it's even broken up by the staff that has provided the service. There's a question here. Is there a list of report names from Simon to myAvatar? Yeah, I think we did create one. I have to check on it to see where it's at, and if we do have one, maybe Eric might be
Yeah, I
able
think
to.
we do. Let me search for it while we're doing the training, and if I do, I'll make it available.
Awesome. Thank you, sir.
Thank you.
Anything else? Do you guys want me to go over it one more time before we move on? Okay, no problem.
We have two that said yes, please. So we can do a quick review.
Okay, I'm gonna switch to this other client, 4013. Client ledger. Double click to open the form. Going to enter in the client MR number. Double click here. Let's do episode specific again. And remember, we only enter services into the 00036. So we're not going to select the MH Financial here. We're going to select the San Bernardino County outpatient episode. Again, the from and to date self-populated because this is the first date that we open the client and it's today's date. So the search parameters cannot be outside of that. I'm going to pull up the Crystal report here and process. And here we are. Click on a couple different hyperlinks. So the claim for this service has not gone through. So this information is not there. Okay, I'm going to go ahead and close it. Click yes, and let's view the simple report. Process. And here we are.
Okay, I'm sorry. I'm going to be asking a lot of questions. On that on the first screen where it said open, if the claim had been processed, would that say closed?
Yes, it should say closed once the claim has gone through.
Thank you.
You're welcome. Alrighty. I'm going to wait just a second to see if any more questions come through, and then we'll move on to the next section of training, which is group management.
And you're good on time too, so. Any questions that you guys have for the client ledger or ancillary services?
I'm ready.
All right, go.
Let's jump in. Okay, so the next section is group management. So as you can see, if you're kind of unfamiliar with the group forms, you can just type in group and it's going to pull them up. To create a group, you're going to go to group registration here. Oh, double click. And it's going to ask you to select a group. So since Mr. iPhone is my main client, I'm going to search for Apple Group. No matches found. Please refine search. So you can look for a group by using this form, and you can create a new one. So let's go to new group here. It's going to ask if you want to auto assign the next group ID number. Let's click yes. This takes us to the group registration form. You can always find the name of the form that you're in right here. So group registration date is today. Is this group a family? This one's not going to be a family. It can have people outside of their immediate family in it. Here you can enter a group description if you want, maybe what the goals of the group are. Let's just put work on social skills. Whoops. Here you can designate a group capacity. Let's say that you don't want there to be over 7 members in the group. And here you can select different groups that are associated with it. Maybe once a month they meet together with another group. You can select that here. So this is basically registering the group. Over here in the left-hand column, we can go to the next page, which is group member assignment. And just like we did on the diagnosis page, if we want to add an item, you have to click Add New Item here. Now it's highlighted, and we get to put in what item we're going to add right there. So the first one is going to be Mr. iPhone. We're going to select the San Bernardino County outpatient episode here. The group assignment start date is going to be here. And let's add another member. Again, San Bernardino County outpatient episode. And they also started the group today. That's all there is on this form, is these 2 pages, creating the group and adding members to the group. Once you've double checked your work, everything looks good. Click submit here. And you've now created the group. So the group assignment would be used for, sometimes therapists will have a group, maybe a depression group, different groups that they provide group therapy. Not every program uses this. In the outpatient clinics, it's used probably more frequently than in specialty programs. So let's pull up the different group forms again. Here we can add members to a group. Let's go ahead and look at that form. Oh, okay, let me cancel that. So I had this gentleman here highlighted. So it immediately wanted me to add him to the group. But let's click on Lily here. And go to group member assignment form. We're going to assign it using the San Bernardino County outpatient episode, which is already highlighted here. So we just click OK. This person is already a part of 2 groups here. So we can add one. We're going to assign her to that group as of today. Apple group. And here you can multiple select groups. See how once I selected that one, it brought it down into the selected groups? If, let's say today they are added into 2 different groups, then we would just search the second one and double click on it again, and it will bring it down into this box. After you're done with the form and you've selected the group or groups that the client is going to be assigned to, you click submit here. It's asking if we want to return to the pre-display. We don't need to because we're done with assigning this client to groups. So we can select no, and it should kick us back out to the home view. So now these 3 people right here are all part of the Apple group. So here you can terminate a group. You can view group member listing. You can edit a group registration date. Let's click on group termination. Okay, so we already selected the group that we are going to terminate. Let's say the therapy group has achieved its goal and it was only to run a course of 6 months. So that 6 months is now up. You can enter the termination date here for today and submit, and it'll terminate that group. I'm not going to do that just yet though. So I click the X here, and it's asking me if I want to close the form without submitting. I'm going to select yes. Let's go back into groups. And let's go to, let's unselect that. And let's go to group member assignment. I think I'm going into the right form. If not, I'll just backtrack. Okay, so here it takes us to the pre-display. We added Mr. iPhone to the Apple group in the San Bernardino County OP episode. So we're going to select OK there. And you'll see that the group name is right here. And let's say that this member was no longer going to be attending this group. So we can click today here and submit. It's asking if we want to return to the pre-display. Let's click yes. And now you'll see that they were assigned to that group on this date and that their assignment to that group ended on that date. So that would be how you can take a member out of a group without terminating the group. Can you please go over how you named the group again? Sure. So we're going to go to group registration. And here is where you get to select the group name. Immediately it asks you to search for a group or to select a name. So let's go to depression therapy. See how there's already a name right here? So we know that we cannot name a new group that same name because one currently exists. Depression therapy group. And then we go to new group here. It's asking if it wants us to auto assign next ID number. We're going to click yes. And that's how we selected the group name during the group registration form. I'm going to close this out without submitting it. Are you sure you want to close without submitting? Yes. And it kicks us back to the home view. So that's how you manage groups. Was there any questions?
You guys are so quiet. You want to make sure you ask any questions.
So I am going to leave Rose Hawkeye here highlighted. And I'm going to come over to search forms. And let's say we want to add Rose to an existing group. Then at this point, we can go to group member assignment here. It should, yes, it took us to the pre-display, giving us the episodes. So we're going to want to add this episode to the group. So we're going to click OK. And the group assignment start date is going to be today. And here's where you search what group you want to add them to. I'm going to add them to Apple group. And it put Apple group in the selected groups right here. And that is it. We can submit this form now. And it asks us if we want to go back to the pre-display. Let's click yes this time. And here we can check and make sure that we did it correctly. So we're in Rose Hawkeye's profile, and in this pre-display, it shows that she was assigned to the Apple group here on August 5th today. If you want to add her to another group, we can go ahead and do that from this screen as well, just by clicking add here. It will put us back into the group member assignment form, and we can look up the next group that we want to assign them to. Double click there. So because multiple groups popped up right here, it's telling me that the group that I selected, depression group, is related to these other groups. I forgot to click on the group assignment start date before I did that. So it erased the groups that I selected to add. You see this message that popped up? It looks like the group A New Way of Life has met its capacity. So it's saying the client will be skipped from filling into these associated groups. And see how that group was removed from down here? So let's click submit. And let's return to the pre-display again so we can see what we just did. And now they are assigned to the depression group here.
Hey, Matthew, you got a question saying from Diana, I had a hard time adding my fake client to the group. Can you go over that one more time?
Yes, I was just going over it right now.
I'm sorry, I'm jumping in and out. I apologize. My apologies.
No worries. Thank you for keeping an eye on that. Okay, so I'm going to do it again just real fast, just in case I moved a little too quickly there, and so that it'll hopefully sink in a little bit better. Okay, so I have my client highlighted under recent clients here. We're going to go to group member assignment to assign that client to a group. Double click on the form to open it. It's going to take us to the pre-display of the client's episodes. This is the episode we're going to assign the client to the group under. So we click OK. And you click Add. Here's the second pre-display. It shows us the groups that the client is already assigned to. And if we want to add a new group, you click Add down here at the bottom. You select today's date or whatever date, but we're going to assign them to it as of today. And then here you type in the group that you're searching for that you want to add them to. Let's just type in T and see what pops up. Let's do test group. So when I double clicked on the test group, it added them. It added test group here, and now we could click submit. And to double check to make sure what we did was done correctly, let's go back to the pre-display. And now test group should show up in the pre-display as groups that this member is assigned to, right here on this date. Now I'm going to go back into group member assignment for Rose Hawkeye. We're going to look at the groups that are assigned under this episode. And for test group right here, we're going to edit it. And she's going to no longer be a part of this group as of today's date. And submit that. Let's return to pre-display. And I'm just going over this again. I know I went over it already, but I just want to go over it again for you guys. And now under group assignment end date, she is no longer enrolled in the test group. Alrighty, any questions?
Matt, sorry, I'm about to answer your question.
Okay.
And my computer started acting up, but I'll just say no for now. And maybe we can do one later. Not maybe, but we can do it later.
Okay, for sure.
They're probably going to need one after.
Yeah. All right, so if there's no more questions, our next section is the scheduling calendar. So this is kind of a big one. I'm not sure how many of you are familiar with appointments everywhere, but basically the scheduling calendar aspect of myAvatar is going to take the spot of appointments everywhere. So to go to the scheduling calendar, you can search it here in the Forms and Data widget under Search Forms. Double click on it to open it up. And here it is. So there's a lot to look at right off the bat here. This big square here is the grid, or what I've referred to as the grid, the calendar grid. And you can manage the way it looks by using this over here, the left margin. You can switch between different reporting units here. Keep in mind that we're in the training system, so a lot of this information here is going to be incomplete. But when you're in the live system, you will have in this dropdown the sites that you have access to. So let's go back up to Barstow. And it gives us this selection here of different provider staff that we can add to the calendar grid over here. So let's add Susan. Let's add Michelle. So here we see Sunday, August 2nd, and we have a column for Susan and a column for Michelle. On to Monday, a column for each of them as well. And the more staff that you select, the further out it pushes things, because now we have 5 staff for each day. So to view more, we would have to scroll more over here. So that could be a lot to kind of look at. So if you know that you're going to just be operating within one staff's calendar, then you can unselect these and make it a little bit more manageable. Alrighty. So in this, we already have a few appointments right here. We also have lunch blocks, and there's multiple different types of blocks that we can do. And if you look down at this legend at the bottom, it kind of tells you what type of block you're looking at based off of the color. Okay. Over here, you can change the view of the calendar grid to day, which now we're looking at one day all the way across, to week, which is what we were currently looking at, or month, which is kind of difficult to see, kind of difficult to manage. More than likely, when I use this moving forward, I'm going to be staying in the weekly view, but it kind of depends on what you're looking for. In this small calendar here, you can jump around by clicking on the date. And then to go back to today's date, you just click on this button here, today, and it takes you back. You can jump forward a whole month by clicking on these little side arrows, or you can also do it by selecting it in this drop down here by month or year. So currently the way the grid is set up is each slot here is 15 minutes. You can adjust that as well by coming down here and making it every 10 minutes, 5 minutes, or as much as 30 minutes. So it depends on what you want viewable, as well as what are your appointment durations as to how you set that up. "15 minutes seems pretty standard though. So I'm gonna stay on 15 minutes. Right here we have these check boxes, which will change the view of what we're looking at. So some of these change the view of this column here. Filter panel, we took it away completely. Let's bring it back. The date filter, took that away completely. Let's bring it back. Let's see. Show MR number. So look right here on this client's appointment. It has their MR number, 1616. So you can choose to take that off. You can choose to take the name off. You can choose to take both of them off. So in taking both of them off, the benefit there, I would think, is if you're trying to hide PHI because you're demonstrating something to someone and they don't need to know the client's information. Other than that, I don't know. You guys can explore the reasons why you would take them off or add them and different things like that. Right here, we have some hyperlinks that take us to forms. So let's say we're looking for a new appointment for a client. We're going to look under Susan Adams. Okay. So find new appointment. We're going to search in that site. We're going to search under Susan Adams. And we're going to start the search for today and end it in 2 months' time. So let's do that. Another way that you can select that, of course, is just by typing in the date or by clicking on this calendar here and manually clicking on the date that you want the search to end on. But let's get fancy and just put T plus 60. And tab off of it, and it'll automatically calculate that for you. So here you can select the search duration. Are you looking for a 30-minute appointment? Are you looking for a 60-minute appointment? And here you get to select how many search results display. There's some practitioner demographics that you can select here. But we're just going to select Susan Adams as the practitioner for right now. Here you can select search days of the week. What days of the week? Maybe the client's only available on Tuesday. So you can click Tuesday here. Maybe they're available Tuesday and Thursday, or whatever the case may be, but you can select those there. I'm going to select Wednesday. All right. Now let's find the availability. I didn't even address this. Okay, so the search start time and search end time. Let's say that the client's only available in the afternoon. So we can select 12 p.m. to 4 p.m. there. Or whatever the case may be, depending on the client's availability. So now let's find the availability of Susan Adams for an appointment for a client. And here it gives us a list of those. Because we only put 10 search results, it's only displayed 10 for us. You can click on one to select it. Let's click on this one here. And click OK. And that takes us into scheduling the appointment. So at this time, you can scroll down a little bit. Select your service code. I'm going to select 560. Once I selected 560, it recognized that that is a direct service. So it automatically jumped me to the client, telling me that I have to select a client since it's a client-directed service. Let's go ahead and select that client, Mr. iPhone. And now it jumped me over to episode number, telling me that I have to select an episode. Remember, we don't attach services to the MH Financial, so we're not going to select that. We're going to select the San Bernardino County outpatient. Okay. So we're always supposed to verify the insurance. So that should be done when you're making an appointment and or when you're checking a client in. So the benefit of doing it when you're checking a client in is the client is there, and if they have issues with their insurance, then because they're there, you can have them speak with a financial interviewer at that time to get it squared away. I have a question here. What if the morning schedule is always 15-minute intervals, but the afternoon schedule is always 30 minutes? So that's okay. I'll go ahead and show what we can do after I make this appointment and we go back to the calendar grid. Okay, so I scrolled back up to the top to just kind of double check things and make sure everything looks good. We're gonna schedule it with Susan Adams on this date at this time. It's 60 minutes. It's gonna end at this time. At this program, it's a DBH site. So here's something else to keep in mind. A lot of our appointments right now are not located at a DBH site. They are going to be non-face-to-face because they're over the phone. So keep that in mind that while we're doing this over the phone sessions, you may want to find out and make sure that you are selecting the correct location type. If you're scheduling a group, then you can select your group number here. But this is a 560. So that's individual. So it's not letting me select a group here, and it's having me select a client here. Closer down at the bottom, you can select if you want it to be a reoccurring appointment every however many days, and if you want it to end after so many sessions or no end at all. You can select the days of the week that you want it to reoccur on. And here is where you can select evidence-based practices if that applies. You can add notes to the appointment, like added appointment per Dr. So-and-so. Okay, so after you look at everything and make sure that everything looks good, I have a question here. Does staff have access to their avatar calendar during phase 1? No, they do not. Some staff might, but generally speaking across the board, no. They're not going to get access until phase 2 when they receive their login for myAvatar. Okay, so we can click on team and look at the next page. Select the practitioners on the team that will participate in the appointment. This is individual everything, so there's nothing to enter there. Okay, and we don't have a group member, so it's not even letting me go to the group members page. So we can go back to appointment details, take a final look, and click submit. Okay. So now what we can do to double check and just take a look at the appointment, where it was scheduled at and everything, we can go to find existing appointment. And we're going to look in this site. Our search date is going to be today. You can display canceled appointments here. Why not? Let's click yes. And let's select our client. So I'm going to leave a lot of the search parameters open so I get as many search results as possible, even though I know only one will show up. And here it gives us that appointment. Because I clicked on it and clicked OK, it kicks me back to the calendar grid and to the location where the appointment is at. So let's say to answer the question, what if morning schedule is 15 and afternoon is 30? There's a few easy ways that we can do that, and probably the easiest way is to make an appointment. You can click and drag on here. So let's look at tomorrow. If an appointment is at 9 o'clock, it's only going to be 15 minutes. And because I have 15 minutes right here, I don't need to change anything. I know that one of these slots is 15 minutes already. So I can just right click here in this one slot and go to add appointment. This will automatically tell the system that the appointment start time is 9 and ends at 9:15. Let's do another 560 code and just go through and select everything. Double click there. Client is going to be our client. It wants me to enter this. Okay, now I'm going to submit it. And here it popped up, and it's only for the 15 minutes. Now let's say we're scheduling something for the afternoon. Rather than changing this at all, what you can do, if it's at 4 p.m., is you can click and drag. Okay, well that used to be an option. Interesting. Anyways, okay, so there's other ways we can go about it. You can go to add appointment. And then just manually change the time here. The duration to 30 minutes. And when we do that, we're going to see the appointment end time change right here. And let's submit it and make the appointment. And now we're going to see that that appointment time takes up 2 slots to total 30 minutes. That's probably the quickest way to do that. But you can also just change it to 30 here and then make one appointment time, add appointment. And because I changed it down there on the calendar grid, it's automatically going to have it at 30 minutes right here. So I'm going to go back out to the grid here. Any questions so far? Okay. So I have a question. Please go over how to change the appointment intervals again. So to change them from the calendar grid here, you would use this little slide bar over here. And you could slide it across like this, or you can click on the positive and negative signs here. So if we want a 30-minute appointment, see how it says 30 right here? And now each one of these individual slots is 30 minutes. Or let's say we want it to be 15 minutes, then you could drop it to 15. And now each one of these individual slots is 15. Let's say that we're just going to keep it at 30 right here. And after lunch right here, we're going to add an appointment. You can also change the appointment interval here by manually changing it. Let's say we want it to be 45 minutes long. Uh-oh, staff has another appointment, no overbooking. Okay, no appointments will be scheduled. Uh-oh, I made it mad at me. Not all appointments are scheduled. Would you like the system to continue searching for available time? Nah. Scheduling aborted, okay. So let's close it and just search for a time that we have something more available. Let's do it right here. Let's add appointments. Let's change this to 45. Let's see if it lets me. Yay, okay, we're good. Good to move forward. Service code 560. It's gonna drop me down to the client right here, 4012. Select your episode, San Bernardino County outpatient. Scroll back up because it didn't have me select the program or the location. Insurance verified, yes. And click submit. So now, even though this is 30, this appointment is from 11 to 11:45. So it's gonna look a little bit funky right here because it's splitting this time slot in half. Let's say Susan came to you and was like, hey, you know what? I'm not going to be available for that appointment at 11 o'clock. See if the client can come in the afternoon. What you can do for a quick fix in rescheduling it is click and hold and drag them down to a different time spot. And now that appointment time has changed. That's probably like one of the easiest ways to reschedule. And you can even move them between days and just have that appointment fly all over the place. Another way to do that, to reschedule, would be to right click and click reschedule right here. It should take, it automatically, it graded out. So what it did basically was it put it in copy. Like if you were to do a Control C, now it's copied that appointment. And let's look at November. We're going to schedule this appointment here. Let's add the appointment here. Oh man, I should have pasted. My bad. I'm going to go back out. So let's paste the appointment here. And now it moved the appointment there. So for those of you familiar with Appointments Everywhere, I think that the rescheduling feature here in myAvatar is probably, not probably, it's a lot easier. Let's go back to today. And we could see that that appointment was moved from here over to that day. Any questions so far on that rescheduling? Yeah. The look is even pretty similar to Outlook.
And I think now would be a good time for a break.
Sounds good.
So we want to take a quick 15-minute break and we resume right back at 2:45 and then we'll pick up from there.
Awesome. Thanks,
All right,
Eric.
thanks, guys.
Okay, so we're going to resume with scheduling a group appointment at this time. Let's go ahead and right click on our desired time that the appointment will start on the calendar grid here. Let's put it for Friday. Friday at 4. And let's go to add appointment. Let's change the duration to 1 hour. So 60 minutes here. Select our program. And what are we going to do? 551, I think. There it is. Have to add that G, I think. 551G for a group. And because it's a group code with that G right there, now my group number is required over here. Let's schedule our Apple group for it. We're not going to make it reoccurring or anything like that, but you can, because many times groups, pretty much every time, a group therapy session is going to be reoccurring. Usually it lands on a certain day of the week or every other week. But we're not going to do that right here. Okay, everything looks good. And let's submit. We should see it pop up over here. Apple group from 4 to 5 p.m. Rehab ADL. And that's it. Again, you can click and drag and move your appointment around just like if it were an individual appointment, but it's a group appointment.
Matt, can you show them checking people in or doing attendance for appointments?
Sure.
Thank
So
you.
right here, you can right click on the appointment block. So let's say iPhone shows up to this appointment. We can check them in after right clicking. It's a future appointment, so it doesn't like that. Let's make it not a future appointment by bringing it right here. No, she doesn't. Okay. Let's check it in. Okay. So here's a little message telling us there's no prepayment service code. So that's prepayment is going to have to do with financial and what their payment plan and all that stuff is. So let's click OK. It's going to ask us what we want to check in. And it has this appointment right here. The one that we clicked on is the one that we're going to want to check in. During check-in, verifying the insurance is a requirement. So you have to click yes or no. If no, then you have to give the reason here. Client did not have it. Client refused. Did not ask. Hopefully we're not using that one. But let's click yes.
Hey, Matthew, since the clients are already in there, shouldn't that have already been verified, the insurance verified?
Yes, but let's say the appointment was made 2 months ago.
Mm-hmm.
And we would want to verify it again because within that 2 months, maybe their insurance coverage changed.
So every time we go to check in someone, regardless if the insurance verified says yes, it's always going to go back there just to double check it?
I'm sorry, maybe I missed something. It's always going to go back where?
To this screen, because before you were in another screen that said verify insurance, because we didn't verify the insurance. And then you come back here, you're like, okay, yes, we need to verify the insurance. But initially, when the person comes in, this client iPhone, we should say, yes, they've already been insured. But are you saying that if we put them in, because it's not a required field, the yes and the no, that they can be in the system without that? So by the time they get assigned to something, then that would prompt us that Susan Adams, iPhone hasn't had her insurance verified. Is that right?
I see. Yes, I believe so. Because when you make the appointment, it asks you of that, but it's not a required field. Is that what you mean?
Yeah, so then now I have, let's say it's like you said, 2 months later, the person's been in the system, they haven't done any group stuff. But out of the 5 people that are going to be in that group, one of the people haven't had their insurance verified. So is it going to allow us to go ahead and enroll the other 4 and then stop when it gets to that 5th one because the insurance hasn't been verified? Or is it going to check for each one every time?
It should check for each one, but what's going to happen is you can click no. It's just that you have to give a reason then. So let's say the insurance was verified for the 4, but not the 5th, and you need to get the 5th verified. Well, then
Okay.
you can go ahead and take the moment to verify the 5th, and then click yes. Or let's say it's not compatible, and then you would click no, and then just give the reason.
Okay. Okay. I'm sorry. That's good. I thank you for the clarification.
You're welcome. I hope it clarified it. It's kind of confusing, and it's easier once it plays out and you see it happening.
No, you know what I forgot? I forgot that every time a person has a service or a group, the insurance has to say, yes, you can go ahead and do it and we'll cover it.
Right.
That's what I forgot. Okay, thank you.
You're welcome. Okay, so here's the check-in, scheduling calendar check-in form. Here's the appointment, insurance verified, submit. And now this appointment right here has been checked in, the client has been checked in, and you're gonna see this little check mark right here. It's your indicator that it's been checked in. Yes, Sarah, yeah, we want to check that at each time that they check in, definitely. Okay, I'm gonna hang on for just a second before I move on to reports. Okay. Clicking on reports. So actually, I'm going to go back out. Okay. The scheduling calendar. So I'm in the scheduling calendar, and over here in these hyperlinks down here, the bottom one is going to say reports. And that's where we can pull up scheduling calendar reports. First, let's see. Let's just open it. There are a couple different reports that we can print here. And the first selection that we can pick is, do we want our report to display canceled appointments? Yes or no? It really depends on what you're looking for in your report search results. So you can click yes if that's something that you need, or no. It depends. If we click on Print Practitioner Quick Schedule here, thinking. I didn't select any search parameters at the time. Okay, still thinking. I think the search results were too wide. Okay. So I'm gonna skip that because, no, let's not skip it. Site. So let's select our site and let's select our practitioner. Where'd she go? There she is. Okay, there we go. And now let's click Print Practitioner's Quick Schedule. Now that we've selected the site and the practitioner, the search result kind of catch basin should be smaller, and it shouldn't take so long for the report to generate. Let's check it out.
Yeah. Yeah. Or Sue? Yeah, so Sue's grandson and my son are going to be in the same class.
I'll wait just another moment, but for some reason it's taking a long time.
It is.
I wanted to give you guys a view of what it looked like, but we may just have to bypass that for right now. And you guys saw how to generate it. And then if you guys get some time in the future, just go ahead and go in and play with that a little bit. Yeah, because this, I don't know what's going on here. So let's close that. We can also print appointment reminders for the client in this spot. So let's do it from the client viewpoint. Let's enter in our client 4012. And I think the parameters that we set it for was it would print a few appointments into the future. And here we go. It gave us these two. At the bottom, it has please arrive 15 minutes before your appointment. If you need to cancel, call the office at least 24 hours before your appointment. It has your client name here. It has the DBH information here. The time that the appointment slip was ran, and the appointment information here. Up in this corner, you can choose to print it out. Okay. I'm going to close that. So on the print practitioner quick schedule, that's going to give you a list of each practitioner's appointments for the whole day. So let's say if we select this site right here, but we don't select the practitioner, then it's going to print out every practitioner at that site's appointments for the day. So for certain outpatient clinics, this might be beneficial. If you're still having to pull charts, you will know what you need to pull based off of that for each practitioner, and you can make the start date for tomorrow. Let's say you pull your charts 1 day in advance. And if we're doing it to make it a pull list, then we wouldn't want to display canceled appointments. So we leave that at no, and you could go to print schedule. So you can use that as a pull list that will give you all of the appointments for the site. Or if you have other uses for that, you can use it for other reasons. Maybe you want to keep track of how many appointments you have for each day. You can have it include canceled appointments if you want. Alrighty, any questions? I'm trying to keep an eye over here on the chat. All right, not seeing any questions coming through. So that is the scheduling calendar reports located here. Next up, we have crystal reports. So you can search your crystal reports in the home view. Let's go ahead and dismiss. You can close out the scheduling calendar. You can see it open up here, but let's close it out by clicking dismiss down here, which takes us back to the home view. Let's see. So I have a small list of reports that we can go over. And I just want to show you guys how to pull them and what the names of them are. So the first one being the Medi-Cal eligibility roster, MHS 134. So if you know the quick name, the name that it used to be in Simon, you can search many of the reports by their Simon name. Or if you don't know that, but you know what the name of the report is, you can search it by that. So I'm going to double click on that to open the report up. Let's say we want it for July. Oh yeah, I forgot. Okay, so we're in the training environment and it doesn't have all of the reporting units loaded into this spot right here. So let's just click any of them and go to process to start your report running. Processing report has completed. Do you wish to return to form? I'm going to click no, which will take us back to the home view. So in the test environment, in the training environment, it doesn't have very much information entered into it. So we're not getting any client data back on this report, but these are the different pieces of information that would come back on it. Okay, I'm going to close that out. Next, we're going to look up the MHS 140 or face sheet.
The reports that you are talking about, that they're, if you know the one that's in Simon or the one that's in myAvatar, do you have a list of those comparable ones too? Like this equals this?
Yeah, I think we do. And I think Eric was going to look for that.
I thought he was looking for the forms, or is that something different too?
Oh, forms? Okay.
I just wanted to know if they were both. So you have them both.
I think we do have them both.
Okay, thank you.
Yes, I am looking for both.
Thank you.
I am actually, Dr. Frausto, I'm going to forward what I have right here to you, and I'm going to CC Eric.
It's Lana Frausto. I'm her sister.
Oh, okay. Hello.
Thank you. It's Maria Elena.
Okay. Maria Elena. There it is. Okay. And let's CC Eric on this. I don't know if we can make like a list from this email that I'm sending to you guys, if we're unable to find one maybe, but here we go. All right.
I'll take a look at it and let you know.
Cool. Okay, so the next thing that we're going to look up is the 140. Whoops. There we go. And we kind of already looked at this earlier, but I'm just going down the list. I want to show you guys what the crystal reports are. So it pre-populated that client's information into the patient ID field because I had it highlighted on the home view. And then we click process here. Okay, crystal reports are taking some time this afternoon. There we go. Great, and we have quite a bit of information on here. So it looks very similar to the previous 140. You have client demographic information up here at the top. One thing that we did have them add was the FI code and the FI expiration on here. So you're going to see that is something new. You're going to have the insurance information below that. And below that, you're going to have the emergency contact information. Further down is going to be the different programs that the client is opened at. And below that, well, we can't see it on here because the client doesn't have any closed programs, but it also lists the closed programs. Very similar to the old 140. The only thing is that you guys are going to want to keep in mind when you're operating in the new system, and I touched on this earlier this morning, but is these right here, this MESA counseling right here, this is no longer called an episode, but it's called a program assignment. So that's why it says program right here instead of episode. You're going to have your opening date here. It's still open, so you're not going to have a closing date here. The clinician and physician that it was assigned to. If there are any services, you're going to have that listed here. The last service. The legal current. I think, what do we normally see that as during voluntary services? It's like W60,000 or something like that. And I'm going to zoom in a little bit. There we go. Okay, I'm going to look over here. I'm seeing some questions. Okay. No, I don't believe it can be changed. This is something that that was in development and has completed development. We can bring it up, but I'm pretty sure that this is what it's going to look like. Was there anything specifically that you guys?
That's correct. Just to verify what you said, Matt.
Yeah, it's just something that we're going to have to get used to. Everything looks a little bit different, and we just kind of have to kind of roll with that and get used to the way it looks. Let me see. Plus, the provider's first name would be beneficial. Yeah, I could see that, especially if there's maybe a lot of Smiths or something. But this is what it looks like. This is what we're going to be dealing with for the MHS 140. Okay, I'm going to close that out. Do I want to return to the form? No. So there's different places that you can locate the provider's first name. One is right here in client information. So it's assigned to Agnes Nelson right here. That's probably the easiest spot. If you want to look for more information, you could double click on there. Double click on the client and open the chart. And you'll have more information here by opening the chart. And then to close the chart back out, you click on this X. Yes, Karina, what is your question?
So I work in a mental health and a SED clinic, and I am the setter's OA, but I also help with mental health. So when I have access to SED, so when I do a 140, does it pull up all information for substance abuse as well as mental health?
Because the restrictions for SUDS is a lot higher, mental health services are not going to be able to pull that information. If your permissions are different, you might be able to view both at the same time.
And that's why I asked, because of the restrictions on that, because they like to get like mental health staff when I'm assigning a screening, because we work with probation, they'd like to get the 140 so that they can review. Now, my only concern, or the reason why I asked the question, is because I have access to SED. If it comes up when I'm running that 140 for mental health, is it providing the mental health staff, which don't yet have permission from the client to have access to SED, is it providing all of that information for them when I send it over?
Karina, I think Matt best decided, since we don't have access, we can't see that. Are you scheduled or registered for the SUDS training on the 12th?
I have already had that back in the beginning when we first did the trainings. However, that wasn't something that they went over in the training, was whether or not there was a different form, because the form they actually pulled up was the mental health 140. Like it said
Can you
mental
send
health on there.
just so I don't lose track, can you email me the question and I'll follow up with our SUD super user? They're not
Definitely.
available this week, but I can follow up next week.
Okay, thank you for that.
No problem.
Awesome. Very good question. Okay. There's this report I forgot the name of, but I am going to look for it. Master Client Inquiry. I think this is it. Okay. So it's kind of like a beefed up MHS 140. I'm going to pull it up for this guy right here. Do that. Master Client Inquiry. Select episode number. Let's go here. Process. What do we have? Processing report has completed. Do you wish to return to form? No. Okay, so you'll see much of the same information as the 140 on your first sheet here, but also it has these hyperlinks down at the bottom where you can get a lot more information. So I kind of see us almost moving away from using the 140 and starting to use this a little bit more because it has more information. The 140, I think, is more beneficial in terms of you see a little bit more on the first page and you don't have to click on one of these hyperlinks. So if you're looking to print it out and give it to someone, maybe the MHS 140 might be better. But if you're looking to look at a history of the client, this might be a better form for us to use.
Name of that form again?
I'm sorry, I didn't hear that.
Name of that form?
It's the Master Client Inquiry.
Thank you.
So that wasn't on the list that I have. I'm going to just go through the list because we do have a little bit of time. You know what? I think I didn't give you guys any time to schedule appointments. So I'm going to go over a few more reports, and then if you guys want to use the scheduling calendar a little bit and kind of explore a little bit in that, then you guys might run into some hiccups or speed bumps, and I can help you answer some questions. So let's go over a few more reports first, and then we'll jump back over to the scheduling calendar. So the next one that we have here is the MHS 142. So I'm just going to type in 142. And this report is a summary description of a client's demographic and clinical history. So let's have it begin on, let's just have it begin and end today. Reporting units. It's one that might have something. None of those.
There's no all?
Yeah, we can do all because it's not a required field. I think my only concern is it might take a little while for it to process the report. Let's see how long it takes. So see how I didn't enter in a reporting unit? So that's kind of your way of doing an all search for all of the reporting units. And here we go. That's page 1. If you look up over here in the corner, you could see there's multiple pages of this report. So we can page over to Phoenix now. And it's giving you a summary of the services. Okay. I'm going to close that one out. The next one that we can go over is the missing social security number report. Okay. I'm not sure where that report went. Let's pull up the staff caseload summary. Okay. And we can have the begin date of July 1st and the end date of today. Program. I wonder if anything is going to be here. Let's not select anything here so we can broaden our search process.
Reports are taking extra long to longer than normal.
Sure are. And I don't even think there's that many service providers for it to be searching through in this environment. Okay, I'm going to go ahead and close it out. There's 2 reports I want to make sure that I go over with you guys. And these are the 902 reports. So they're not called 902 reports anymore. For anyone who's entered billing knows that we use the 902 reports to audit our service entry. Whoops. Indirect. So for indirect services, it's called indirect service input verification. This is the equivalent of your 902 for indirect services. Okay, let's process that. And here we have that 431 that I entered in earlier. So again, this looks very similar to the old 902. It even says report MHS 902 up at the top. Right here, you can see in this header that it's the indirect service detail input verification report. And these should be listed and separated by practitioner. Okay, so that's for indirect. I'm going to close that out. Let's go to direct. And this one is called direct service detail input verification. So we're going to select the reporting unit. Let's click today's date because we know we entered some services in today. And let's process it. Okay. And here we are. It's showing us the services that we entered in earlier for our client iPhone. Again, it's calling it the MHS 902 at the top. You have your procedure code, client date of birth. And you have the summary down at the bottom here. This is the same thing. These should be grouped by practitioner. So this, all of Agnes's will show up here, and then the next person's will show up grouped together here. Okay, I'm going to close it. Okay, let's see. We have a question here. Uh-oh, I'm sorry, I'm not paying good enough attention over here to the chat. So let me go ahead and pull up one of those reports that I just did. Let's go for the direct, and I'm just gonna zoom in just so you guys can see a little bit better before moving on to the next question over here in the chat. Okay, I hope you guys can see a little bit better now. So let's search for the word page. Let's see how this search function works.
Can I bring your attention to a question in the chat? It says,
Okay.
say I make a mistake on one of the 902s, would I go back to direct billing to correct it or client charge input?
You would want to go to edit service information. Unless it's a mistake on an indirect service that you put in. If it's indirect, I believe that you have to delete the service and then re-enter it in. I'm going to pull up a 9. 912 report real fast. Client services listing. Let's just process it. All right, I kind of like that. It's kind of a clean looking report here. Thank you for asking for that, Margarita. I'm going to close it. So you're reviewing the 902 and you're seeing, you see an error and you're like, oh my goodness, what's going on here? I got to fix this. So then you would go to edit service information. We touched on this a little earlier. So let's say the time is wrong. So you would utilize these search parameters here to search for the service. And then you would select the service and you would change the duration. Or if the service code is wrong, then you would change it over here. Okay, let's come over here. Let's type in delete. So let's say you find an error on an indirect service. You would have to go here to go to practitioner only service delete. And search for that service. What was the name? And then delete that service. Click delete here. It tells you it's deleted now. Click OK. So that's how you delete an indirect service. Notice that you can't use the submit button here. Everything that you do in this form is in the actual form, not in this column here. So after you've deleted it, then you would want to go back in and enter it in correctly. Any other questions about those reports? No. Alrighty. Let's go ahead and go back to the scheduling calendar. Have any of you guys made appointments on there yet while we were going through the demonstration? Awesome. Good job, guys. I'd like to give you guys a little bit of time to go ahead and explore in that and scheduling, maybe scheduling a group, deleting the appointment, checking them in, moving the appointment, rescheduling it, and the different ways that you can do that. So go ahead and take a few minutes for that. And please speak up or type in the chat if you have any questions.